Thank you. Good morning. How's everyone doing today? How's everyone's legs feeling? Anyone else have sore calves? That's the thing about round dancing is you always go in the same direction, so you get some. If you're not in shape like me, you feel a bit sore the next day. But it was such a beautiful night last night, right? I want to, just thank again AHT for putting that on for us, for organizing the round dance. Thank the announcer, who was hilarious, so funny, but also really informative. Like, I feel like that's a really tricky job to do, and he was so good. And then all the singers and drummers who we were so lucky to hear, their voices were so strong. Their songs were so, you just had to feel like you wanted to get out there and dance. And even the backup singers were so good. I was really, I've been talking a lot at home about the last few days and everything that we've been hearing from all of our speakers and wanting to share that with my family, especially yesterday. I have a 12-year-old, and when Dr. Makokis was talking yesterday about how he's working with the youth and how he's helping to, remake those connections to our culture and our land, I was thinking, I should have taken my kid out of school so they could have been here to see this today. But I was able to bring them back for the round dance last night, and I think we all left feeling, it was so nice to share just a little bit of the magic that I've been feeling in this room over the last 2 days with them and with my family. So I'm so grateful to everybody last night, but for you all today as well. You might notice I have new glasses today because I couldn't find my glasses this morning. I forgot to clean them. I don't know if you can tell, but they're really, really, you guys are all just kind of foggy. I'm going to clean them out. I would like to begin again our day, in a good way with words from Gahandagwas, Diane Longboat. So let's welcome her to the stage.
Well, good morning, everybody, all you beautiful people. It's such an honor for me to stand here with you this morning and bring you some of the things that we discovered, were taught, were shown at that sacred fire this morning. And I'll include some of those teachings in the morning invocation. So please relax, close your eyes, add your words to my words, whatever language that you want to use, whatever faith tradition you want to express as well. Because all those faith traditions and all those words all rise to the Creator. And that sacred fire that's burning out there is so strong. So this morning, we were privileged for the rains that came that were so gentle. And so today we'll talk about those rains. Nyawa sangwe di sanganalunqua, gahandagwas yunyats, sego scano, sewguego, gahandagwas yunyats. So grateful to you, Sangwe Disong, for such a beautiful day, for the messages from the sky world this morning that brought us to a time and a place of acknowledging how beautiful our Mother the Earth is and her challenge during this time of the equinox. We thank you for gathering dust and pollen from those magnificent places in the universe and swirling them together to create our Mother the Earth. And when you did so, you made a place for us in the universe where we could thrive. When you did that, you put an infinite power of love inside of her, that she would continuously love us, care for us, provide for us all the sustenance that we need with water, with food, with medicines, everything we need to have a good life. And so it is, back at the beginning of creation and today. We think about Indigenous, those waters, the great Lake Ontario, that is part of the biggest freshwater system in the whole world. And we have the privilege of living right beside her. We give thanks to her. And to all the waters, underground, the waters on top of the ground, that grandmother who stands in the fresh water, the grandmother who stood in the rain today, the grandmother who stands in the salt waters, the grandmother who stands at the time of birth waters. We give thanks this day and raise up all of those waters of the earth, for they are the first and the finest of all the medicines. Today, we lift up and give thanks and honor to all the plant life that is here. Medicine plants, food plants, corn, beans, and squash, the three sisters. To all the meshkiki, all the medicines that are keeping us healthy, all those medicines that are doing what pharmaceutical medicines cannot, because our own medicines carry the Spirit. So today, when we think about all those beautiful medicines, the plant life, the tree life, the medicine life, the food life, all of those, we honor them and give thanks to them. And to all those foods that are nourishing us on the outside of this room, we honor them. We also lift up and honor the animals. They are great brothers and sisters to us. They have so many teachings for us about how to be a good human being by watching them and their families. We draw our clans from them. They show us teachings and guidance about what it is to be a good human being. We also think about those flyers, the ones that stayed with us over the winter, and the ones that went south but are returning to us now. And when we wake up in the morning and that sun is rising, we see that the birds gather in big flocks in fields. And when the sun rises and that first light breaks, they rise up from that field and they give thanks to the Creator in their way for a brand new day. We're thinking today and giving thanks and raising up all the beings in the waters. Thinking about those whales holding the wisdom of creation. Those whales that are coming close to the land now. Some of them indeed beaching themselves. And how important it is to understand the language of spirit that each and every one of us can speak. To understand what the messages are that are coming from the whales. The song that they are singing that is going into the universe, into outer space. The song from outer space that is coming in to meet their song, and it is the same song. We give thanks and honor to the unseen forces, those four grandfather winds, refreshing and cleansing Mother Earth, and to Ladiwelos, those thunder beings. 10 of them, different sounds, different formations of lightning, different colors. They all have a profound meaning for us. We acknowledge them today for bringing the rains from the high heavens of the spirit world to the earth. And we thank them today for that gentle female rain that rained on us at the sunrise ceremony. We honor today all the stars that represent our ancestors. And for those of you who left that round dance last night and went outside, those stars were brighter than bright. We give thanks for all the star formations that teach us when to hold our ceremonies. They teach us about our origin stories. We thank our grandmother, the moon, who is also coming into her fullness, taking care of the tides of water on the earth, pulling them so that all those living beings underneath will have nourishment, keeping the waters moving on Mother Earth so that Mother Earth can survive. Taking care of fertility in the female life, making sure we always have babies coming to join us. It's so important. It's such a gift. Today, we give thanks to our elder brother, the sun, and the medicine of light that he brings to all of us each day, burning off yesterday, giving us a chance at a brand new day today. Understanding that when we get up and we give our greetings to the sun the first thing in the morning and drink the sacred water that we're holding, that sun's light is so powerful that when it hits that water, it turns it into medicine. And that medicine, when we drink it, goes inside of us, and it changes us in every cell of our body for that day. And we continue to do it day after day after day after day. And we begin to change. How powerful is that water and that sun? We honor the Milky Way with 2 roads on it. One with the new babies coming in to join us. The other one with souls leaving to find their rest. And a renewed spiritual mandate from the Creator. Because we know that there is no such thing as death. There is only transition. And so that transition gives us even more power on the other side to work for the Creator. And so we find on the other side of that beautiful star and sky road, strawberries on each side of that trail, and we smell them, how sweet they are. And we arrive at that place in the sky world, and some of you have seen that. A big grassy open field, big trees surrounding that field, and a fire burning in the center. And what happens there is that we join the fires of our ancestors. So we give thanks this day that we see these things, that these things have been revealed to us. And the Creator's council fire. The great ones are seated there, beings that assisted the Creator from the very beginning of time to create the earth, and those beings that continuously visit us and teach us and guide us and correct us. They bring a profound and deep healing to us. So we honor them. We honor all those beings that are seated there. And we say that there are 4 sacred beings that the Creator will lower to the earth one by one in times of great need. So we have been promised that. So today, Songwe Diso, our Creator, the one who made all things, we thank you for this equinox. We thank you for the message that you gave us through one of our chiefs and faith keepers, Tom Porter. And that message was on the equinox to pray for Mother Earth because she's getting tired now. She's indeed moving and circulating slower than she used to. And so we have a duty and responsibility to lift her up and show her how much we love her by gathering as families, gathering in ceremony, making sure that she knows how grateful we are for all the life that she provides for us, and having a feast at end of day to celebrate that. So today, when we think about this beautiful day that lies ahead, we think about already the things that we have been gifted with here. An answer to your question: how do we develop our own Indigenous health system? And Dr. Makokas laid out a roadmap for us yesterday. Dr. Brenda will do the same today for mental health. And our Maori relatives have shown us what it is to have a powerful family. What is a good family? What do you teach your family? How do you walk in the world as that family? How do you stand strong in the world? Unshakable, fearless to support the language, the culture, the ceremonies that you come from, standing with your own ancestors. And so today, Creator, I stand here to humbly give thanks on behalf of my family who's gathered here today, to say thank you for all of what you have blessed us with. Brilliant, beautiful, magnificent Ongwehongwe and Anishinaabe people, beautiful people. And all of the songs, the ceremonies, the languages, the cultures, everything that we need to be successful. So thank you, Creator, on behalf of everyone. Nyawa, miigwech. Miigwech.
Thank you so much, Diane, for those words and for so eloquently summing up all of the gifts that we've been given over the last few days here. I'm so excited for today because, I feel like just gratitude to the organizers for the lineup that they've curated for us and how each day and each teaching is building on each other into the next session, into the next teacher that comes up and shares some of their knowledge and is so generous with their teachings and their words. And I'm really excited about our next speaker as well. We are honored to welcome Dr. Brenda Restoule, a proud Anishinaabe psychologist from Doki's First Nation and CEO of the First Peoples Wellness Circle. For over 25 years, Dr. Restoule has provided clinical and consulting services to Anishinaabe communities. She's helping to develop mental health programs and advocating for Indigenous-led wellness initiatives. Dr. Restoule played a key role in shaping national First Nations mental wellness frameworks, including the First Nation Mental Wellness Continuum Framework. She has worked extensively with Indigenous and non-Indigenous organizations, as well as provincial and federal governments, to advance culturally grounded mental wellness strategies. Please join me in welcoming Dr. Brenda Restoule.
Whew, I'm glad they didn't keep that up there too long. I'm like, that's my face. I don't want to look there. Good morning, Ani, Bojo. Beautiful prayer, Elder Diane, Miigwech. I got so much out of that, and even though I haven't been here for the last 2 days, I could feel the strength just through the prayers. It's hard to follow an elder. They do such amazing work and have such important and profound words. Ani Bojo, Wabsequence Dijnakaz, Magizi Dodem, Kikandot Donjaba, Anishinaabe and Dao, Debendigo Saking. It's a pleasure to join you this morning. I am the CEO of First Peoples Wellness Circle, and I have the pleasure to come and talk about something called Models of Care for Substance Use. I just wanted to share that this model of care is work that has been started through the Thunderbird Partnership Foundation, and we are a sister organization with Thunderbird Partnership Foundation. We do many things together, and we are co-hosting a very important group of women, mainly women at this moment, to do work in our regions. And those women, one of those women was tasked with creating a model of care around substance use. So you're going to see that this presentation has a lot of branding from Thunderbird because Thunderbird was leading the work, but we certainly are part of supporting and promoting this work in communities. This model of care for substance use, I was sitting with Elder Kevin, and he asked me, so did you create this? I said, that's what I'm going to talk about this morning. This is a brand new model. It's something that they have just released in the last few months and are just starting this work. So in some ways, you're the first group who really gets to hear about it. They've been piloting it in a couple of communities, and I'm happy to have the opportunity to share it with you. And I'm still learning about it, so please accept my potential awkwardness as I attempt to make sure that I'm describing it as well as I can. There we go. So our stories and our experiences have always told us what we've always known. And I heard that so much this morning from our elder Diane, that we're strong and resilient people. Despite all we have experienced throughout the generations, we've remained strong. We have persevered, and we continue to grow and flourish as a people, as families, as communities, and as nations. But sometimes there are some of us who struggle, who experience challenge, whose lives are fraught with difficulties and hardship. Why is this so? What causes things to be so different within a nation, a community, and even within our families? Because we know of that to be true, and we wonder why. You know, we get asked those questions, and I'm sure some of you have been asked that, like, why are things good for you but not for that person? You know, I certainly had that experience as a young psychologist, and sometimes those questions are good because they make us reflect. You know, at that time, I remember when I got asked that question, I think my response, we were in a residential school experience, and it was a psychologist who was supervising me and asked me, like, so, like, you know, hearing all these stories about residential school, like, what's different for you? And I was like, my family didn't go to residential school. Like, that was just kind of like a knee-jerk reaction. But, like, I'm a day school survivor. My dad's a day school survivor. My grandparents are day school survivors, right? Like, and I remember thinking, after she asked that question, I was like, why does she think I'm different? I actually completely understood what they were talking about. I've lived that. I've lived, like, alcoholism and domestic violence and suicide. Like, I've lived those things. I'm not different. I have a PhD. That doesn't make me different, you know, in terms of our experiences as people. But, you know, it made me think and have to reflect a little bit on, like, why would she ask that? And am I different? And why do some of us have hardships? And when I thought about it, I thought, well, we do have shared experiences and more similarities. But some of us are sometimes more fortunate enough to be lifted beyond those things. What she saw was people, or in her eyes, or worldview, was how much I had attained this high status, which made me different. But what she didn't know, like I said, was that I wasn't that different. I had experienced all of those things. And more, things that they didn't always talk about: racism and discrimination, loss of language, fear of believing in our culture and practices, all of those things. What I understood was we have both the similarities and the differences that make us strong, resilient, and flourishing families, communities, and nations. And it's about connection. That's what I realized, what might have made me different, or why I didn't struggle as much, is because I had really strong connections to family, to community, to water, to land, and to territory, and to identity, to stories, to the songs, to the language, to our families, and to our ancestors. I realized it was about having a path that is laid out for us by those that have come before us. And I realized that was my great-grandparents and my grandparents, our chief of our community, who was a very strong leader. They had all given us opportunities and given us the opportunity to live a different life. And it's in those different experiences, I think, that determine how and what we do with that that's been given to us, what we do and how it's been given to us. So ultimately, all of this comes from our culture and our knowledge and our evidence. And so my discussion today about the models of care is thinking about those things: what is given to us and what are we reclaiming? What are we bringing back into our communities, into our families, and into our homes that can support us to address what continues to be a challenge, that epidemic of substance use? And we know that means that, you know, it's not just the substances that are the problem in our community, but rather we recognize that these crises of drugs is much beyond that. You know, if we focus on the drugs, there'll always be another drug that comes after it, right? Think about, in my father's time, it was about alcoholism. And we did amazing things to address alcoholism in our communities. We know that Indigenous people actually report having less alcohol use. That's actually true than the Canadian population. Like, we need to pat ourselves on the back because we did that because of culture. Yes, we have higher rates of binge drinking, but we have a path forward to address alcoholism, and we've seen so many people change in our communities as a result of it. So the real crisis really isn't about substances and which drugs we have to deal with. We do need to address that, but that's not the root issue. We need to deal with those historic and current factors that put our people at higher risk of harmful drug use. So that means we have to recognize our substance use is intertwined with so many other things. The erosion of our culture, of our languages, of our connections, those connections to land, to identity, to waters, that is what we need to address. All of those intergenerational impacts of colonial violence and harms. Here it says residential schools, but I always now say like colonial violence. We experience colonial violence, and that's what we're dealing with, and that's what we need to address, because they create the deep traumas, those intergenerational traumas. So one of the things that work has happened with Thunderbird, and I've had the great pleasure to be able to sit alongside Thunderbird in this model. For those of you who don't recognize it, it's called Honoring Our Strengths. It's a renewed framework to address substance use amongst First Nations communities. And it was launched in late 2013, early 2014. It was work that was co-created by Thunderbird and the Assembly of First Nation. And it was really about rethinking the NADAP program and what are some of the new things that they had to focus on. And this year, Thunderbird is doing a refresh of the Honoring Our Strengths because, that was 10 years ago. We have much more toxic drugs in our community. And so thinking about our language and our understanding, we know far more about harm reduction than we did 10 years ago. And so those sorts of things need to be included, understanding about addictions, medicine, and even the work that we've done through culture around land. So they're looking to do a refresh. But you can see in this model that the elements of care, as described through Honoring Our Strengths, is intended to reflect a continuum of care approach, matching the people who are affected by substance use to the kinds of services and supports they need at any point in their care. This work was guided by First Nations in the communities, helping to think through all of what you see here. And you'll see when you look at it in that center point, they said, and we continue to be guided by, the importance of culture. That culture is at the foundation of the work that we must do, and that is nestled within our families and our communities and within our kin. And they have 6 different elements. The Honoring Our Strengths has 6 different elements that you need to consider when you think about developing a model of care. So some of those elements are around how do we do that at a community level. So the community development approach and thinking about our prevention and promotion and those aspects that we can be building. So those round dances, are part of prevention and promotion. We're teaching our young people about connection, about the importance of language and family and belonging, all of those things. And so that's one of the pieces that we need to have in order to create a really strong model of care for substance use, because it's not just at the treatment end. And sometimes we feel pressured to do it at the intervention or treatment end because so many of our people are suffering and so many of our people are dying on a daily basis from the toxic drugs in our community. But we also have to think about how we're building up those young people to be stronger, to be able to flourish and thrive. The second element here talks about early identification and brief interventions and aftercare. So how can we help those who are early on perhaps struggling and giving them alternative ways to manage and cope, to address those harms that they've experienced. Element 3, it talks about looking at secondary risk factors. So what are the secondary risks, maybe to the individual, like health-related secondary risks, but it can be secondary risks to our families and to our communities. It's not just the individual who's struggling with substance use that needs support, right? We've all probably been there. You know somebody who's struggled with an addictions, and we were impacted by their behaviors, by their lack of connection, or their the challenges that we watch them face and are sometimes feeling unable to support them with. And then, of course, there's the active treatment. As I said earlier, that's the part we feel pressured right now to be making sure that we have interventions. And sometimes we hear in the community, like, those treatment centers, they're not doing enough. You know, they won't take people because they're actively using, but we need something for them. Those treatment centers, they have to wait too long. Like, somebody needs to go today, but they're not taking them for months. So we know it's not just a treatment end or an intervention end, but rather that we have a lot of things that we should be doing and could be doing at a community level to support. And then there's specialized treatments. Sometimes that's residential treatments, but it can also be our culturally based treatments that we don't always recognize as specialized treatments. And the final element is around care facilitation. So what are the things we can do as part of care in terms of creating models of care to support well-being and to support addressing substance use? That brownish circle, I'm not going to talk a lot about it, but that really is just those supporting elements, those things that are necessary in the creation of a model of care. So I'll just point out, like, we need to ensure that we have a strong and healthy workforce who can do this work, ensuring that we consider their well-being, that we have the mechanisms in place to ensure that we're training them adequately to address what people are coming in with, because they come in with some very difficult stories and some very difficult experiences, and they need the skills, the workforce needs the skills to be able to support them and navigate them through that. You know, so being able to have those elements in place to support a strong model of care. And that sort of grayish circle out there, the outer circle, that is really recognizing all of the critical components that must be woven into a model of care, being spirit-centered. So yes, we could do all kinds of sort of Western-based models of care around substance use, but if it doesn't come from the place of spirit, we know that it doesn't always work, and we've already heard that in our communities. We've heard our communities talk about, our members of our community saying, like, I'd been to treatment centers before and it didn't always work for me, but once I connected to my culture and I learned about my identity and I regained you know, a sense of pride in who I was, then things really changed for me. And that comes from spirit, you know. So a model of care needs to ensure that it's considering how we invest in the spirit of that person, but also the spirit in our communities and our nations, by bringing in culture and language and bringing in our connection to water and land. You know, and it talks here about connection, and it talks about meeting a person holistically, that we just can't deal with the addictions. We need to deal with the other issues that are behind it that affect their ability to manage and cope, whether that's, you know, being able to manage and address issues in relationships or dealing with trauma. So we really need to be thinking at a holistic level, but we also need to be recognizing that it is a model that can't focus just on individuals, because if we focus just on individuals, we're going to be here for a really long time, right? And we don't have enough money to do it at an individual level. We need to be doing it at a community level and at a family level, because when we invest in our communities, when we invest in our families, we see changes happening in individuals, right? So we need to really be doing those sorts of things. Not saying we don't support the one person who's struggling, but I'm saying we just don't support people. We need to support families. We need to support communities in doing this work. So the model of care, what I'm going to share with you today is a template around how to create a model of care for substance use. And it's a document that's been developed to accompany the Honoring Our Strengths Renewal Framework, as well as some other work that Thunderbird did through a research initiative around the First Nations opioid and methamphetamine guidelines. And the First Nations opioid and methamphetamine guidelines that they've been using and go into communities where they have surveys and they have discussions with communities about understanding the issues related to opioids and methamphetamines in their communities and how to address it and help them create a bit of a plan to address that. And so bringing together the Honoring Our Strengths Renewal framework with that guideline around addressing those toxic drugs, this model of care is then used to support a path or a picture of what can be done in communities to support them to address the toxic drug use in the communities. You know, as I was saying earlier, First Nations, the word treatment for us automatically creates an image of things like a treatment center or a residential facility. And many of our people are frustrated with those treatment centers because they have the perception that treatment centers are not addressing the needs of people who use opioids or methamphetamines or benzodiazepines and other substances like xylazine. You know, the way that First Nations have addressed alcohol are not going to work for these drugs. But without experience of community-based interventions, the questions remain: what will work? What are the skills of the workforce to provide services? What are the skills of the workforce required to provide services? Where should these services be offered, and how does culture play a role in spirit-centered services? The question also is, what's harm reduction? So with the Honoring Our Strengths Renewal framework, the details of designing community-based interventions isn't there. It's a model, like the Honoring Our Strengths gives a framework about what needs to happen, but it's not the details. So I've heard, and this is true of the framework, First Nations Mental Wellness Continuum framework as well, is this is really great, but like what do I do with this? How do I make it a living thing in my community? And so the model of care for substance use is to put the details into the Honoring Our Strengths by giving people some information to create that roadmap. You know, First Nation communities are only funded for prevention level work often. And so intervention requires a different workforce, and addressing the drug crisis requires a very different budget. The model of care is intended to assess community strengths and challenges and what partnerships exist to ensure that services can be brought into communities. The template was developed in response to a request by a group of First Nations, actually in northern Saskatchewan, a health authority there who requested in January of last year by Thunderbird and First Peoples to go in and support them to establish a model of care to address substance use in their health authority. With this work, a starting place has been around the creation of this standard template that has been drafted, as I mentioned earlier, to facilitate the implementation of the Honoring Our Strengths Renewal Framework. The model of care is intended to be a companion around the updated HOS renewal framework that I say we're working on right now. Thunderbird is planning to release that refreshed model in the fall of this year, and I'm planning a gathering. So if this is something you're keen to know more about, keep your eyes out. Thunderbird will be hosting that in the fall. And the model of care offers a model for addressing the drug crisis from the perspective of First Nation communities as the hub for holistic and wraparound services. This slide shows two different things, and it might be a little bit hard to read, and my apologies for that. I realize the wording is really small, but the table on the left of the screen is directly from the Honoring Our Strengths Renewal Framework, and those are the elements of care that I was mentioning to you, and you can see that it talks about who are they addressing, right? So it goes everything from different elements, it's for the whole community, all the way to people who are at high risk of use, to those who have severe issues. So it's meant to cover the gamut. And then it talks about in each of the elements, what are the different types of supports and services that you might consider in each of them. So, and I talked a little bit about all of them, except for might not have touched as much around things like includes looking at screening and assessment, referral, case management, all the way at the end to looking at care coordination and ensuring cultural competency in this work. That's what that's about, and I'll explain how they go together. But the image on the right of the screen is a model that has been framed after the Honoring Our Strengths, and it's in this model, the community is the hub for services. And that model is something that Carol and I had the opportunity to hear during the pandemic, where we hosted a number of conversations about mental wellness needs in First Nations, Inuit, and Métis communities during the pandemic. And we had a really, really long conversation with communities in the North. This was meant to be targeted in the North around substance use. And we heard about this model of care that was being used in the North, where they were looking at creating a hub and how the hub was supporting their work. And so the hub requires partnerships. And so you see at the center, that big purple circle is the community. And all of those outside circles are different partnerships. And those partnerships are across the determinants of health, including those that are external to the community. So some of them are internal, right? They're the health center, their social service departments, maybe their culture departments, the justice program, because we know often justice gets involved with the toxic drug use in our communities. But it also has included external partners. And so in this community, it included addictions medicine specialists and others who might be coming into the community to assist in addressing the needs of community members. So this model shifts the current paradigm that requires First Nations to leave their communities and to seek services elsewhere. We were really intrigued to hear that what they did was recognize at the center of it was the community workers and the community services, and everything connected back. So any of those spokes, any of those partners in those spokes had a responsibility to do their piece of the work, but they had to connect back into community. And I don't know about you, but my time working in communities, I've had, especially in the mental health people who are not well and they go to the hospital and like kind of forget about them. You know, they're not there, you're not working with them in that moment, or not really forgetting about them, but you're not connected to them. And then all of a sudden you hear they're back, right? And you're like, oh, no one told me, the hospital never called. You know, so this model requires that you can't do that. You can't go off to the addictions medicine and just do your thing over there and you have no idea what's going on. You have to be able to come back, that addictions medicine has to come back and reconnect to the community workers and talk about their work and create really like a wraparound service. And so having a model of care where the community is at the hub and where they can draw in different components of the continuum of care for services, so people get services as close to home as they can in ways that are meaningful for them, is a different way of doing business in First Nations communities. So often, you know, these things are very different because in the past, there has been no support for navigating access to services, and they certainly weren't culturally relevant. So by keeping it in the community, we keep it culturally grounded, but also it's much easier to navigate because the person isn't having to go into all those systems. The system is having to come into community and support services in community. So that the challenges of navigating the system, which is fraught with so many problems, from racism and discrimination to lack of access and lack of understanding, et cetera, those things get reduced, those challenges are reduced, and the likelihood of people falling through the cracks or finding those gaps can also be reduced, because part of this hub and spoke model is the community does the problem solving to address the gaps, to address those needs in community by identifying who else and where else do they need to pull in services. The other important aspect of the community hub model are things like regulated professionals working with unregulated community-based professionals like elders and culturally based practitioners, an outreach workforce that some of our communities have, and people with lived and living experience. Often there's no equitable funding for community-based workforces, but their role is vital to addressing the harms to the community created by the drug crisis. So we know that our community workforce does not get equitably paid and they're not resourced. There's not enough of them to do the work, but they know the people. They know their stories. And they also know the culture. They also know ways of connecting to the land. They know ways of connecting to the water. They know ways of connecting to language. They know how to bring people to spaces that give them a sense of belonging or purpose and hope. You know, so bringing them to those fires, bringing them to those round dances, bringing them to community circles or maybe even community luncheons where they're welcomed in. Those are all parts of that work. The other thing about this model is when First Nations people have to leave their community to seek services in urban environments, they've often been drawn into things like gangs and human trafficking more easily because perhaps they, leave that treatment center earlier or they get kicked out. They're not ready to complete it, and that's when they get pulled into these very high-risk situations, and then we know those things aren't really services that help with continue living. If we think about the work of addressing substance use, it's about a model of living. It's about a model of supporting how we connect to Creator and connect to creation. But things like gangs and human trafficking are models of not living, of numbness, of sort of dying inside, if you will. So, that the medication that we need to support the right to life is really around culture and not in those areas of drugs, as well as other health care to address the impact of chronic drug use. So we know that this model is intended to reduce those high-risk situations. And the third is around coordination of care, and that's what I mentioned earlier, where it requires the community to have the infrastructure to enable their participation in saving lives and to shift their focus from survival to wellness. So we just don't want people to live day to day. We want them to thrive and to flourish. And what do we need to do that? This model also shifts the focus from criminalization of First Nations for chronic health conditions, because let's make no mistake of it, substance use is a chronic health condition. People live with it their entire lives, right? And there's no cure, but there is recovery. So we need to be thinking about the fact that we need to stop criminalizing First Nations people for having a chronic substance use condition. We don't put our people in jail for diabetes. Why are we putting our people in jail for substance use when that's not the way forward? It's just simply a psychological and physical dependence on drugs, and how do we support people to not be dependent on that, but rather to be dependent on their culture, the land, our mother, the earth, creation, the teachings, our practices, and our ceremonies. So the template is really intended to have diversity to support different types of communities. It's intended to be intentionally broad to facilitate community-specific development through community engagement, and recognizing that there's diversity of our people and the organizations, so that this model has to be theirs. They have to own that model. It has to meet their needs and their priorities. And it also requires that it attends to resources. So because we know First Nations are diverse in their languages and their culture, and even in their how they connect to land and environment, it's important that this model that these differences have to be recognized within this model. So the design of the model has to recognize those differences. But because of colonizations, communities have varying understandings of the role of language and culture and connection to land and creation, and the impact or influence it has in playing a part towards wellness. So they may even have a belief in their identity, but they're not sure how to infuse in the program design and policy what the inclusion of language, culture, and land. So this model of care, the template for it, helps them to think through those pieces because they may not be sure. We have also, Thunderbird has also developed a land-based, actually we both have, developed a land-based service delivery model. Through our work through the framework, we heard from the mental wellness workforce and from First Nations regional representatives back in about 2017, 2018. They said there was a larger desire to be able to do work on the land. And they said, but we don't always know how to do that. And so together, Thunderbird led the work, and much of First Peoples was part of the conversation. In fact, they chaired the conversation. Our thought leader, Dr. Bill Mussel, chaired that conversation. We developed a land-based service delivery model that's intended to assist First Nations and government in understanding how land-based services can be an effective intervention to address substance use and promote wellness. So I'll show you in this next slide how land-based services make a difference. That service delivery model, for people who are interested, you can find it on Thunderbird's website. Our website is under construction, so it'll be harder to find on ours, so do go to Thunderbird's website. And the land-based service delivery model is also a bit of a template. It helps people think through what do you need, what are the components you need to develop a land-based model of care. And this slide just acknowledges that in these land-based services, it's an acknowledgement that land and cultural practices are healing, and they are and that Western-based models of care are complementary, but that we can lay the foundation of our work in the land and bring in those pieces of Western-based services like, let's say, cognitive behavioral therapy as it's needed, but it does not have to be the central component of it. It requires in land-based services that we use experiential activities to learn about our strengths and our gifts and to offer support without judgment. How many times have we been out on the land and we're not quite sure how to do something? The land doesn't go, you did that wrong, right? You just try again, right? You flip your canoe, you get back in, and you try again. That's what we do. You know, it also helps us to understand what we're good at and to develop those skills and those gifts, and the land supports that. And if you've been on the land with people who are healing, what I love about it is just that quiet way of showing people what they know. You know, the elders sitting there and whittling, you know, maybe carving. The elders sitting and just sharing a story, and nobody's looking at each other. You know, that's the thing about therapy. People have to look at me. Who wants to look? You know, let's look ahead, not look at each other, where we can be more open and vulnerable. And sometimes that's much safer for people than having to look somebody in the eye, which Western-based people say, you know, look at people in the eye. That tells you that you've got a strong leader. But that's not what our elders do. Our elders don't look people in the eye in that way. They do that. And so, you know, the land gives that opportunity. It provides that leadership role for our elders who understand the land and could point out those small things about what the animals are doing and how those our animal relatives can tell us about living and being good humans, as our elder talked about this morning. You know, and it's based so much on our community values and practices. The type of land-based services you'll find on the East Coast out by the ocean is going to be very different from the ones you'll find in my community, you know, which is back in the bush, or the ones up in the north, or the ones in the prairies. It's going to be different, but it'll be based on their values. and their practices. And it supports the development of relationships, relationships with others who are doing this work on the land and with the elders, but the relationship with our plant relatives, our relatives that are four-legged and in the waters and in the skies and the stars and all those things that Diane talked about. It promotes those relationships in ways that help them to see that they're part of something bigger than themselves, that they contribute to something and something contributes to their wellness, that there's reciprocity in relationships and they have something to give. And that creates for them a sense of meaning and purpose in their life. It also, doing land-based work, promotes language development, and which is part of healthy development. We could sit on and listen to elders speak, even if we don't know the language, and we can pick things up. We begin to understand what they're saying. And it allows people to join at a level that they're comfortable with when they're ready to do that work, and includes opportunities for storytelling, because we're such big storytellers, and using that to integrate into our learning. And so what's happened is Thunderbird works very closely with treatment centers. And treatment centers, as well as others, but treatment centers particularly, have gotten into the habit of using something called the Native Wellness Assessment. The Native Wellness Assessment is a tool that measures well-being of people and looks at outcomes of hope, belonging, meaning, and purpose, which are at the center of the First Nations Mental Wellness Continuum Framework. And it gives sort of these numbers about the level of hope, purpose, meaning, and belonging that people have in their lives. And so these tables here show pre- and post scores from the Native Wellness Assessment, which measures that difference that culture makes as measured through the outcomes of hope, belonging, meaning, and purpose. And so what you can see is over the 3 years of data that they've collected on almost 3,000 First Nations people who've accessed treatment and participated in culture-based interventions that are connected to land, they showed a consistent improvement in belonging and purpose. And I think that's really interesting and neat information. And they offered me a lapel. I said I didn't need it. Now here I am turning back over and over again. But you'll see that it changed over time. The increase went anywhere from 15% increase in belonging, meaning, and purpose in 2017 and 18, all the way to 2020, where it went up to 19% in purpose and 15% in meaning. So it keeps getting growing every year the more we spend time in that. And why is that important? Well, it means that when we give people an opportunity to be connected to relationships, that makes a big difference. So, the land is represented in belonging around relationships. So having a relationship with beings of creation, including the land, can promote wellness. Purpose is represented as unique ways of being and doing. And in this case, it's facilitating a relationship with the land, who First Nations understand is our first and our true mother. And our mother is always there to take care of us. So all of life that sustains us comes from our mother, the earth. And so you see here, this is actually the Indigenous wellness framework, where you can see what is important around hope, belonging, meaning, and purpose. And if we are looking at those two areas for them, belonging is in that quadrant at the bottom, the emotional quadrant, which is expressed through relationships, family, community, relationships, and our attitude, our recognition of connection to creation. And purpose is in the north, in the physical end, and those physical behaviors are ways of being and doing, and that sense of wholeness, that sense of recognizing that we are part of something greater. So all of those tell us that the land is supporting our well-being. So what are some of the benefits of land-based healing? Well, the focus with land-based healing is to strengthen our overall wellness, and so it, of course, includes things like intergenerational transmission of our culture and our knowledge and our values and the life skills to ensure that we have purpose across our lifespan. Connection to land supports our connection to elders, and also supports elder and senior mental wellness. It gives them a sense of purpose as well, that they are transmitting their knowledge, transmitting their skills down to the next generation. It increases our sense of cultural identity, which improves our self-esteem and our sense of belonging, as I mentioned earlier. It supports family relationships because it cultivates healthy family relationships. Families, as our elder talked about, our families are not just our biological human families, it's our animal families, our star families, our sky families, our water families, all of those. It supports those kind of family relationships, but also things like parenting skills and helps to develop support networks. And it creates healthy coping mechanisms, so it allows us to see and observe problem-solving skills and how to heal from trauma and grief. And it even offers a harm reduction approach, right? About when we're on the land, we see that sometimes you do only a little bit of what people can do. So the squirrel doesn't take all of the nuts the first time. It breaks it down and takes that food off for the fall as it's preparing and harvesting for that. So it helps with a harm reduction approach because we can find those teachings in the land. It is intended, of course, to be a treatment for substance dependency, and there are many here in this province that are using land-based services as a way to address substance use. On Manitoulin Island, they have Gwekwadzuin, which is a land-based program to address substance use. It's one that I can think of. And then, of course, it promotes that wholeness around physical health and well-being. And it gets us out of our heads, out of that digital dependency, out of sitting on the couch and in our house and being isolated. It makes us connect. So it's both a preventative tool, but also a tool that can be used with different populations like young people. And it's an effort at connection with all kinds of community-based services and health determinants. When we think about what is it that we would do with a model of care around culture, there are many ways by which culture is expressed in our communities. There are principal foundational beliefs and concepts that are commonly held that support a unified definition of Indigenous or First Nations culture and primary concepts of the Indigenous worldview, as told to us by Elder Jim Dumont. These culture-based practices are important, spirit-centered practices for all substance use recovery, including addressing the drug crisis. I want to clarify, I'm not saying we should be bringing people who are high into a sweat lodge, but it can be helpful for supporting the family of people who use drugs. Communities have lit a sacred fire to raise awareness on the importance of coming together to support wellness for the community. These fires have been lit in central areas of the community. As people see the fire, they eventually stop and ask, what's happening? Which led people to bringing coffee, sandwiches, more wood, tobacco, cedar, all the medicines to be used for prayers and shelter as they learn that these fires are about supporting the people who are struggling with the toxic drug use in their communities. All the while, people are developing compassion towards the solutions that can help their relatives in the community who are using drugs. When we come together and we start talking about it, we develop compassion instead of sitting in our house saying, oh, those people walking by, they're a nuisance in the community, there's increased violence because of them, we don't know who's here, they're dropping needles. Instead of judgment, these types of community-based practice can open us up to caring and love and compassion and kindness. In this case, a drum group went to the homes of people who sell drugs and sing in front of the homes. And when the person selling the drugs hears the drum, they ask what the drum group is doing. The drum group replies, "We want you to know that the community cares about you." They left and then went to the next home. These are powerful examples of destigmatization, that we care about you even in your own struggles. So I'm going to end by talking quickly or briefly about the different sections in the models of care for substance use. The template has 5 sections. The first one is our current context, and then I'm going to talk about priorities, populations, infrastructure and implementation, and measurement and evaluation. In the first one, the culture is the foundation of strengths. Understanding, so in the first section, there is an understanding that there are natural support networks that are essential supports in the fabric of the community. So this section seeks to identify what types of supports are available, what's the community capacity for things like language fluency, what's the community practices regarding culture, what do they know, how do they practice it, do they have sweat lodges, do they have ceremonies at the times of the equinox, what kinds of teachings are they putting out there, do they have opportunities to bring people together to learn about community-based teachings as well as culturally based teachings, and to what extent are language and culture present within formal programs and service delivery. So is that being infused and embedded within the existing programs and services, or is it something that people are talking about but they don't know how to do? So it's important to start at the foundation of culture by asking the questions around what is happening with culture in this community, what's known, what's being used, and identifying if there's gaps and needs, because that's important in the model of care. In the second part of the template is an opportunity to evaluate and assess the current context. So this section quantifies community demographics and the current issues. So the second part, in that first section, they actually look to talk to the community and find out what kind of community data they have around their needs, around the challenges they have. So that might be through the health needs assessments. Maybe they have that in their community strategy. Maybe education department has some information, social service department. But they have, they might go to the child welfare, they might go to Ontario Works, but they gather as much information they can from the community to understand what is happening in the community. But they use that first part not just from a community level. They also, Thunderbird will take a step back and take a look at what data might be known in that province or territory or region. So what's happening within the region and the territory around data, around substance use, around access to health services, around use of addictions medicine, harm reduction, all those things. They'll ask those questions. And they'll even give a bit of a national perspective of what do we know is happening nationally. So you can see like kind of come out and say, this is the issue at a national level, and as we draw in, here's the issue in the community. And it's really, we really need to focus on these areas because these are heightened. They're maybe higher than the national average. But we also need to see that, oh, these are lower than the national average and maybe even regional averages. So those are strengths and gifts of the community, and we need to build on that. So it helps to kind of give a perspective of where the community's at. The second part outlines the proposed model, including looking at cultural components of the model and programming. So what would be important around a model of care to address substance use, and what kind of cultural components could be put into those pieces, whether it's land-based, that hub and spoke model and the different components of that. Any best practices for community services. So this is in this part, Thunderbird will use its existing database and existing network to talk about what are some best practices happening in other communities related to those specific issues or needs of the particular community or communities they're working with. So it could be things around cultural safety, around trauma-informed care. It might be around addressing racism and discrimination. And then there's an overall literature review to understand the context of using those best practices and how they are working in communities and what kind of data that are coming out of it, as well as any information around partners and collaboration. So this section concludes with a description of the model and the components specific for that community. The third section is in the area of priorities. This section focuses on making a case for change by first outlining the processes and ideas needed for community engagement. To do a model of care for substance use means if it's going to be holistic, the community needs to be involved and they need to see themselves in it. They need to see that they have a space and a role in it. But it also is a place to detail any of the challenges of implementing a continuum of care, such as recognizing the toxic drug crisis in the community and what would be some of the challenges with that, any states of emergencies that may have existed or are currently in place, or what could happen by calling a state of emergency, as well as the challenges around the determinants of health. So if people don't have access to housing, which is a huge issue in our community now, how does that play into it, and what are some things that community needs to do to address the determinants of health to increase the likelihood of success for the individuals and families to address the substance use crisis in their community. And then the fourth section looks at the population. So this section is really focusing on the members, or the in terms of where that focus will be within the model. So they ask 3 primary questions. They ask why these populations. So they really, in that conversation happening in section 2, like have identified the populations that maybe are at higher need. And so why are we talking about these populations? What are some of the best practice approaches in working with that specific population in terms of how we support them? So is it men or young people, or who is it? Or is it people, families with a history of domestic violence, people coming out of jail? So who is it? And then the third is, how are these populations currently being served? So what are they doing to support them in the community, and what are some factors or best practices we know could support them, and are these areas that can be brought into the community? And finally, the fifth one is in the area of infrastructure and implementation. This section is about what a model of care and related services could look like and how to deliver them, including looking at the guiding principles of care. So this comes directly out of the Honoring Our Strengths Renewal Framework. So what are some of the guiding principles that are necessary for care? What are some important components in the design of any program that you're going to create within your community? What are some of the different care or intervention approaches that are necessary to address the substance use needs in the community? Also a whole section, which I mentioned at the beginning, around workforce. You need to pay attention to what existing knowledge and skills the workforce has. Is there other areas of skills and knowledge that need to be built up? Where can they get that type of knowledge and skills? So connecting them to Indigenous organizations like Thunderbird, who offers training, or it can be, into educational programs. And then also about workforce development, so around recruitment and retention, recognizing how do we bring people into this workforce. And in this case, sometimes it's around, like, what if there's not enough cultural practitioners? What can we do to bring more cultural practitioners into the community to, be the lead in bringing culture into community? And then the final section is in the area of measurement and evaluation. We're coming into a time with a possible new government. And I'm not saying this current government isn't interested in data, but this next government, it's all about the numbers. If it is in fact a conservative government that may come in, they want to know the numbers. They don't want to know our stories. They just want to know, did you make a difference? Show me the numbers that said it went up by this % or that %. So this section is really important, sometimes to be able to tell the story to funders in a numbers way, but it's also important in our communities because we have, for time immemorial, always measured things and evaluated things, and we have those skills, although it's sometimes we get told by the colonial systems that we don't measure anything and we just go by a whip and a whim, and that's not the case. We've always evaluated and measured, but this gives a clear place to help communities who usually don't have the resources to invest in the measurement and evaluation component, and talks to communities about what they need to do to measure and evaluate their model of care. So it provides ideas and methods for data collection and analysis around that care model that's being implemented in the community. Some of those areas that are suggested to them is Thunderbird hosts a site called the Addictions Management Information System, where data can be stored and used and pulled, so we get First Nation specific information. Sometimes the challenge is trying to compare apples to oranges using non-Indigenous data doesn't always make sense because it makes us look like things are way worse. But when we start using our own data, we begin to see where we are in relation to other communities and other nations. And it is also a case management system. In that case management system, there are 2 assessment tools that are available to communities to use to monitor change through data collection. And the first I mentioned earlier is the Native Wellness Assessment. That's a free tool, and it has been tested for validity and reliability, and can be used with multiple populations. It can be used at a community level to understand what's happening in community, but also within families and individuals, depending on how you use it. And all of that information can be stored up to the AMOS system, and then Thunderbird can pull out your specific community data and or sort of compare it to other community-based data. And the second is the drug use screening inventory. Again, this is another tool that Thunderbird has led, which measures substance use and mental health and helps to give some understanding. So having those tools and being able to use them to measure change over time are important, and allows you to evaluate where you're going and how to tweak your model of care. So, as I was saying at the beginning, this is a model of care that is newer. They've just started to use it in different health authorities and communities in other parts of the country. So if you are more interested in learning about the model of care, or you think you'd like to bring that to your community to begin to do that evaluation, that assessment of your community and creation of it, I've put here Thunderbird Partnership Foundation's contact information. They've got their email and phone number, and you'd be talking to their policy and partnership team around some of this work. And with that, I say miigwech, and thank you for the opportunity.
Yes, thank you very much, Dr. Restoule. I want to open it up for a Q&A. So I'm sure there's some people out there. We have microphones, so if you have a question, please raise your hand. Oh, there's one there, yeah.
That was excellent.
Thank you.
I have 2 family members that are literally dying, and I've had 7 siblings that have passed away, and 6 of them are a direct result of addiction. 2 of my family members, one is on methadone, and the other one is on Suboxone. And where I live on our territory is a wonderful treatment center. And my family members cannot be admitted in our own home community because they are on methadone and Suboxone. Could you address that, please?
Yeah, I think it varies across different treatment centers. So there are some treatment centers, our NADAP treatment centers, who are now working to have the skills to be able to bring people in who are on methadone and Suboxone, and really moving and shifting towards like a harm reduction approach, if you will, right? Like people who need addictions medicine. In the case that you're talking about, I can't speak to that treatment center, but I would say that there's more and more evidence that treatment centers can be supportive and provide good care with folks who are on methadone and Suboxone, but it's often, I think, an area of developing knowledge for that treatment center to understand addictions medicine, and I think to create the partnerships with addictions medicine specialists to be able to do that work. And often with Suboxone and methadone, there are some very medical pieces to it around testing, like drug screening and all that, and they may not have the capacity within the treatment center to do that. So I think some of the work is about building capacity of treatment centers, and in the last 10 years, the government wasn't focused on intervention, so there hasn't been a lot of investment in treatment centers. And when I've talked to Carol, she said, well, if it gets to be a conservative government, one of the positives is they believe in treatment, so they're going to invest in treatment centers. So we could see some investments in our treatment centers around having access to addictions medicine to be able to support people to go in with methadone and Suboxone and get all those medical components that are necessary to be able to flourish and be able to participate in a treatment center. Yeah.
If there's another question, please raise your hand. Almost as a follow-up to that, though, I'm wondering, like, how is this knowledge being shared across communities, across jurisdictions, across the country? Like you mentioning that you're aware of some evidence that it's actually would be helpful to work with people who are using those drugs. How is that information being shared across nations?
So Thunderbird, we recognize as sort of the leading voice around substance use and around culture. And so they have a variety of ways that they share that information. Of course, Carol attends conferences like this, as do I, to share it that way. But there is lots of information on their website that they use, but they also work closely with treatment centers. So they meet on a very regular basis with treatment centers, and they talk about existing programs and services, and they highlight sort of best practices so that other treatment centers can see maybe work that's happening and thinking about how they could take that information or take that program and adapt it and bring it into their own treatment centers that meets those needs and priorities. So I think a lot of work happens at a treatment center level. There is some work that happens at the government level. So of course, FNIB funds our NADAP treatment centers, and they also meet with treatment centers and have conversations, and Thunderbird works closely with FNIB, and so the information that Thunderbird has, they give to FNIB, so there's that opportunity for that as well. And I think that the last thing that we know is Thunderbird also works with places like the Canadian Centre on Substance Abuse and other organizations to advance information around our own knowledge and evidence and its importance in cultural practices, because those non-Indigenous pan-Canadian health organizations don't know that information. And so they're pushing their models of care, and that doesn't always work for us. And the one thing that we know to be true about our treatment centers is for a long time, the federal government has said that we need to be accredited. So all NADAP treatment centers in this country are accredited. And there's only 60% of all other treatment centers, non-Indigenous, that are accredited. So we actually have more accreditation, which means we have higher standards and we meet higher standards. So that means our models and our treatment centers are much more advanced than many of the others. Amazing. So I think those are positives that we don't know about.
Sure. Yeah, no, for sure. Are there any other questions? I see a hand in the back there. Go ahead.
Oh, hi, good morning. My name is Kim. I'm a nurse practitioner who works at a downtown community health center with an Indigenous team, and I provide care for Indigenous members in the community. So many of our members have alcohol use conditions, chronic, long-term, who are very clear that they're not interested in reducing their use or even stopping their use, and that I respect that. That's okay, because they have a lot of supports. They have our Indigenous team, myself, they have the center, they have a drop-in, they have peer supports. Some may or may not have family support, but they have supports built in. The members that I see, and typically only outside of the building, who are fentanyl users, who don't usually like to come in the building because it draws attention to why they're coming to see me. That is a more challenging group because they have limited supports. They don't have typically family supports. Even at our center, not a lot of supports. Their supports are the other users that they spend their time with. So I find I'm not even sure what my question is. I guess it is how to work with those members when there's not a lot of other things built in around their care.
Yeah, such an important question, and I still hold a small practice in the community I live in. And one of the things that we've noticed for our fentanyl users is in the mental health and addictions program, we just started to find small ways to bring them in. So sometimes they were things like, I'm sure you do, like, giving them snack bags. How do we build relationships? Many of the times it's around food, right? Mm-hmm. So being able to give people food can draw folks in, and of course this population also has difficulty meeting so many basic needs. And I don't know that some of this was done with intention, but some of it, I think, happened organically. When we started to see higher rates of fentanyl in the community, we started to hear from a few people we knew that, they're having difficulty with access to food. So having snack bags when they dropped in, getting them access to clean supplies was another way that might have drawn them in. But it was all about being non-judgmental and being caring, being all those trauma-informed factors that we need to think about, being kind. And some of them were drawn in because they had a need that was that made them refer to us. Like they lost their ID, and we had somebody in our office who could help them apply for and get their ID back, or they needed to get access to some income, and somebody in our office was able to do that. So just starting to meet some of those basic needs was a way to start to build some trust, even if they were known even if they knew us, there was still, of course, that shame, right, around their fentanyl use, and they weren't coming. So having the right people in the position makes a difference. People who are welcoming and caring and kind. And in the case of a First Nation community, sometimes it's somebody who's recognizable, like, I'll talk to you because you're my cousin, or I'll talk to you because I've talked to you before. So we found that by helping people and meeting them where they were at with what they needed really supported their ability to come in. And now we find they'll come in like just to visit and just to talk, because we don't have expectations of them. And I think that's a bit of the challenges, is how do you create a support network within a community that they can trust and rely on, that doesn't come from a judgmental place. I don't know that there's an easy or a quick answer to it, but I really see that the importance of building relationships and building connections is the start, and helping them to meet some of their basic needs, I think, is where they're at, and that's all they can do. And I'm sure that's been your experience, right? Is like they're not ready to talk about their drug use, or they're not ready to change their behaviors, but they are ready to have some place to live, or they are ready to have access to food, and how can we do those things? And then I think our job becomes being good advocates, and how do we create that advocacy? And when we've been working with this group, I was mentioning one person who can help with identification and income and food. And it's a program that they've called in Nipissing Widuk Tadyang. And that program means literally or figuratively, we care for one another. And when she works with them, she actually identifies them as somebody in need of multiple services. And she meets across the social determinants of health with the directors in education, employment, social, health, and culture, and discusses their needs. And as a group, they determine this is somebody who is in need of Widuk Tadyang support. So it's like a wraparound service integration model. And then those folks are able to get access to different parts of the social determinants of health and address any gaps. So instead of saying, well, siloed, they can only come talk to us for this when it comes to income support, and they can only come talk to us for this when it comes to their health. So it becomes an all of community approach to supporting people, and that also then they feel some level of not only support, but safety in that, because they have an advocate in the worker who goes and talks to the social determinants of health and advocates for housing, or if they're in housing and getting themselves in trouble, why they need to stay in housing, why it's important for their well-being. So she becomes their advocate, and of course they usually have an access to an addictions worker and or a mental health therapist. So there's multiple people on the team who can act as advocates, but she herself acts works as an advocate. So I think that if we're able to build in like advocacy positions to support these folks to think holistically or to get access from a holistic place where they can't, that helps build trust and helps build that relationship and build connection so that they're able to get their basic needs met and then start thinking about reducing use. And perhaps sometimes it's about getting on an addictions medicine to start that process. And that's often some of the ways in which we've worked as a suggestion.
Thank you. Let's give a round of applause to Dr. Restoule. Thank you very much. I really appreciate that. It's so nice to meet you. Thank you so much, Dr. Restoule. And I also just, in hearing you speak about all the work that you've been doing and hearing you speak about the way that you're trying to build capacity for not just your community, but other communities, because we're all struggling with a lot of these same issues. It just sparks in me gratitude for the people who are in those communities, who are able to connect with our relatives who are struggling and be that advocate. And I just want to acknowledge them, even if they're here in the room with us, thank you all. But even those who are back home, thank you all so much for doing that really critical work that touches our communities, but also all of our families. We're going to take a short break now. And after the break, please proceed to the designated breakout sessions. If you're attending the wellness session, it will be held again in the Governor General Room on the second floor. Just take the elevator at the end of the foyer. And lunch will be back here in the ballroom immediately following the breakout sessions today at 11:45. So enjoy the break and enjoy the sessions. Thank you.
for the conference, Connie Walker.
Thanks, everyone. We're going to get started. And I just heard from a mom and a little kid who were shopping near the vendors, and the little girl dropped two 20s, $40 she was going to use to buy stickers. So if anybody comes across two 20s, just flag me down and I'll make sure that they get back to them. Well, we are honored today to welcome Angela Grier, Biok Supansky, Singing Loudly Far Away, a proud member of the Piikani First Nation and a dedicated advocate for Indigenous rights. She has worked for over 25 years. She has worked directly with First Nations communities, championing initiatives in bison restoration, food sovereignty, Indigenous governance, and youth advocacy. Angela has held leadership roles in provincial and national organizations, including the Buffalo Treaty, Alberta's First Nations Women's Economic Security Council, and the Canadian Counseling and Psychotherapy Association. She is currently the mental health lead for the Arctic Rose Foundation, supporting Indigenous artists and communities in the North. Please join me in welcoming Angela.
Okay. Does everybody can hear me okay? Can hear? Yeah? Okay, great. Itamik skunat ni nitani ko payok sapansky ni tutawab what sipikani ni siksigates to be. Good morning, everybody. My name is Angela Grier, as mentioned, and my Blackfoot spiritual name is Singing Loudly Far Away. I have been working within my community and territory for the majority of my career, practically my entire career, and have gone on to do other work in advocacy in different respects. I come today from the Piikani Nation of the Blackfoot Confederacy, and I'm going to share a little bit about my territory. I am coming in from this little area here. You could see on the map that was our traditional territory for the Blackfoot people prior to contact, and we still regard it as such. We do have a sister tribe in the States, in Montana, that is our Southern Piikani tribe, and Dr. Tailfeathers, who was here the first day, she had mentioned about our confederacy. That includes her tribe, Kainai, my tribe, Apotsi Piikani, the American tribe is Amskapi Piikani, and then we have Siksika to the north. And so that comprises the Blackfoot Confederation. Before I begin today, I want to acknowledge a few people, and I'm just starting my timer here so I stay on track. But I just want to acknowledge the area in which we are. Thank you for the traditional people of the territory, Mississauga of the Credit, Anishinaabe, Haudenosaunee, and other nations that have called this territory home for many millennials. I'd like to thank the elders, the pipe holders, for their prayers that have been going on every day. Those are very essential and important things I'm going to talk about today. The conference organizers and the invitations, and the MC and her amazing work, and all of the wonderful people who bring us here together. My fellow presenters, of course, who have been, we're going to sort of reiterate a lot of the same things because we're in that alignment, which is a good thing. And all of you here today, of course. I'd like to acknowledge my little conference family there at the back, Robert and Mary's table. Just before I came up today, Robert shared some really beautiful wisdom with me and some really good words. So I'm really thankful to have this little group here as I'm so far away from home. I also want to say that I'm really proud of us, and I'm really proud of our people. I always have been. I've always seen us as mental health advocates. We've shown attention to issues that nobody wants to talk about, things like sexual abuse, things like the residential school traumas. We were always forging new ways ahead in this world. So I'm really proud of us, and I think that that should be acknowledged. My presentation today is from a few different points of view that we're going to talk about. It's important to speak from certain places, and the place that I speak is from the mentorship that I've been under for almost over 25 years with Dr. Leroy Littlebear and his wife Amethyst Firstrider. His name is Ikeskini, which means low horn, and he is the one who influenced this paradigm that I'm going to talk about in this topic today. This is from a First Nation perspective. While I am a psychologist, I always come as a Piikani Blackfoot person first, mother, of course, and woman, and that this is also in work towards decolonization, which has been my life's inquiry, working through understanding colonization for decades, working to understand the impact psychologically from our perspective, and of course, trying to make sense of all of that. And one of the ways I did that was through my graduate work at the U of L, that I couldn't sort of find a school of thought in the psychology frameworks because they were all rooted in that colonial sort of mainstream approach. And if anybody knows of the origins of psychology, it's rooted in white middle-class male development. And so that there's a lot of problems right there in that phrase right there. And so when I had to look at what is really life-saving, what is our psychology, it was very simple. It was our spirituality and our way of life. And so what we call Estutumot Dominiki is the embodiment of wellness, which is what we came up with after my work with the thesis. It is a Blackfoot word that describes embodying things, embodying all of those wellness understandings that we have and we've come to know from a holistic setting. And a key phrase that one of the elders had mentioned is that the trauma takes away our confidence, but the smudge brings it back. And I thought that was a perfect reiteration of what we're talking about and what we were doing. And so my work within Blackfoot territory, if anybody's familiar, we have very empirical processes of transferring knowledge called bomaksin. It's the transfer of authority. And you have to have rights to have that authority or to speak on certain authorities. So our sacred societies are very structured. My son is actively and has been involved since he was young. And that was his journey, and now he's in a very important role in those in our community. So we have very structured ways of transferring knowledge, and so that's the perspective this comes from. And that's going to be important as we go along. So going back to sort of the cusp of the discussion, we talk about paradigm. So what is this word paradigm that I'm sort of throwing around? And I'm going to ask the conference organizers to please send all of the email or all of the PowerPoints to everybody, including me, because I want those. I want to see those PowerPoints. Please send them all out so you guys can just enjoy the presentation. I just want you to. We're going to take in a lot here. So a paradigm is really looking at some of those unconscious things that develop us as groups of people. It drives our ethics. It's a part of our tacit infrastructure of what makes us who we are as groups. It derives ethics. It derives values. It drives values. It's used to establish common communication. And so what we've heard across the last few days is this common discourse that we've all been sort of a part of healing, and we've talked a lot about the land and a lot of these things I'm going to be speaking to. So we have a common language that we've established, and through these conferences and gatherings like this, we are doing what we've always done for millennials. We're coming together, we're sharing and exchanging commerce and information, and we're using our oral traditions to do that. So we're doing what we've always done, right? And we're coming together in this modern context to do that, which is great. A paradigm is important because it constructs societies. So it's these constructs that are put together that sort of develop our society and what we think. And they shape beliefs and attitudes. So when we talk about Ihkeskini's native paradigm, and Ihkeskini is Dr. Leroy Littlebear, and it translates as low horn. And Amethyst's Blackfoot name is Ispinamaki, which means first to the center. And so, like first rider. So these are the words and teachings from them. And in our way, I am just a conduit. I do not own any knowledge. We do not own knowledge. We're conduits of knowledge and information passing through each and every one of us. We don't have that concept of ownership. So just as I wanted to reiterate acknowledgements, I am just somebody who's sharing messages from our ancestors and from the elders and from our teachings. And that is largely what my name means, singing loudly far away, bringing the spirit messages into this world. And so I'm not a singer, my son is, a great one, don't ask me to sing. But the power of song is essential in our ways of life, and we'll talk a little bit more. And so Ihkeskini's native paradigm, when we talked about what a paradigm is, and it has those values, those ethics, those common constructs that develop our society, shapes and values, and it's largely unconscious. So when we're going back to our native paradigm, this paradigm has been developed by Dr. Littlebear. And anybody who doesn't know Dr. Littlebear, anybody know Dr. Littlebear in the room? Leroy. Yeah, Leroy. Yeah, oh, there one comes walking in. Sounds like they were friends. If you don't know Dr. Littlebear, he was the first Indigenous person, First Nation, cited in the Supreme Court. He supported the establishment of Section 35 in changing the Canadian Constitution. He's considered one of the grandfathers of Aboriginal law. So he's kind of an important guy. His passion today is native science. He's out saving the buffalo now. So he's restoring the buffalo, and I'm going to talk about that. Thank you, because we're going to talk about Buffalo Treaty. So he's one of our elders, amazing, incredible human being, 83 years old, putting us all to shame, right? So these are my rock stars. These are my heroes. And he spent a lifetime of, if you've ever had the privilege of hearing his lectures, you can follow, there's some YouTube stuff out there. There's lots of stuff. You Google him, he'll come up. He has been able to take a look at sort of our shared paradigm across our cultures and to come up with this common language, this paradigm here that we see that includes aspects of who we are, who we have been traditionally, what our ancestors encompassed. And what this does is it's going to help us use it as a tool. And this paradigm can be used in any sort of discipline, and I use it from a mental health, psychological perspective. So you can see here the Blackfoot words alongside and then the English on the other, and we're going to go through those one by one. And I'm going to tell you why we're going to do that with the paradigm after. So the first one being constant flux, akwatapio. Akwatapio is a form of mixing and transforming. This is a part of our elements of that there is nothing constant, that everything is in the world is subject to change. Only constant is that there is no constant. That we deform, we reform, and we transform constantly. That everything arises from everything. And just like our seasons are changing, we're having really mild winters right now, which are the onset of climate change and so forth. So we can see this constant flux. What I loved about COVID, it gave us some really good data. It gave us all of that information about when things were stopped and how these animals came into spaces, their traditional spaces, and they were happy and living, and then we all came back and we wrecked it for them. So we learn a lot from these constant changes in our life and our ways of life. So we know that energies are always at work and that they ripple out and that creates change. And so anything that happens today, I will be forever changed after leaving here just by being in connection with you great folks. People have the mastery to change and to manifest life change. This is a solid part of our belief under Akwatapio. And this challenges, the challenges that we face actually create the adversary to have better adaptation and survival. So this is what's been a part of our best practices, our Darwinism of staying here and being alive today when we were supposed to be wiped out. And there was a lot of stories we heard through the conference and that we know of aspects of trying to assimilate and to change that. So when we go into other aspects, we talk about energy. Api. If you look back in the last words, you can see api, akwatapio. So we're going to keep noticing this api word, okay? And there's an important reason for that. Api means energy waves, and spirit is energy. That's what we consider it. And that everything is imbued with a spirit. Even this atmosphere right here has lots of energy waves moving through it. And that these are conscious and unconscious states that we use to communicate with spirit. We have these abilities to do that. There is a combination of specific atmospheric energy waves that allow us humans to exist. And if you alter that, we're gone, right? If you change levels in our atmosphere, we will be annihilated as a human species. Well, Indigenous people are like that too. If you think of a periodic table with the elements, we kind of take this element to create this. And that's sort of how spirit and ceremony works. It's like a periodic table. You have to have the exact right things in place. That's how songs work to activate the plants, is you have to have those certain combinations in place. So Indigenous combinations really come down to our life in ceremony, and ceremony is our life. So ceremony acts as a renewal system of these rites that we use to sustain these energy waves. So we're constantly asking the environment and our relatives to support us, to be kind to us, pity us. Don't be too hard of a winter. Don't be too hard of a drought season, bring the buffalo back. So we ask for those, rites to be here and sustain the energy waves to work in harmony together. And repetition is really necessary for renewal. So this is why we sing the same songs at the same time of year. We dance the same dances. We tell the same stories. These are repetition because these ceremonies, they then manifest and access the shifting energies that we're trying to get. So we can continuously overcome our adversaries. And that's sort of how it's translated in Blackfoot. We pray to overcome those adversaries in our life, whatever they may be. Interrelatedness is also an aspect of the paradigm, Tsukua Kapi. And so you see api again, right? You see the api in there, that energy, that spirit. And so this refers to being related through physicality. So there's a physical element. And again, these English translations, we know English is the lowest language. It's considered a very poor language. It takes the highest academic constructs in the English language to translate our Indigenous languages and concepts. So we know it's not good at what it does. It lacks energy, it lacks emotion. It takes a lot to paint the picture. So the translation of Blackfoot into English is not going to be what it is in Blackfoot. But these are some rudimentary translations so we can get the grasp, okay? So in this interrelatedness, there's an element of that physicality. And again, we see api. When we look at the word niksukua, it's our family, we're all related. We don't have a word for friend. We have only niksukua. So we only see you as a relative, that interrelatedness. And nitsitibisini is what we call our way of life. And so all of the things that we're going to talk about with the paradigm combine to make this nitsitibisini, this way of life. And ceremony is a place where we invite environment, ancestors, and humans all in the same place in this multi-dimensional space. That is very hard for a Western mind to conceptualize that, but this is the workings of the native mind. So ceremony is a place where we bring all of those elements together in our interrelatedness. In the land, we see that our land-based cultures, this is really important for the paradigm and things we're going to talk about, is that the land-based cultures are our kinship. They are our kin, and we heard that from the last speaker, all of these relatives that we have in the sky, beings, the land beings, the water beings, and so forth, that these kinship relationships are developed straight from the specific lands in which we're from. And that's a very important point we're going to get to, because this is not pan-indigeneity. This is cultural specific, okay? The land, therefore, develops out of this relationship our values, our ethics, and our identity. And there is no hierarchies amongst all of our creation. We do not have these hierarchies as dictated in other elements of Western biblical knowledge, or even today, we still see a very male-dominated political spectrums. We wouldn't have half of the problems if there was women in there, just saying. So we don't have these hierarchies. We value all life. There's an interdependency here within this interrelatedness that we know that change in one part of our life will affect change in another. And so we have this holistic sort of framework that we develop out of that. We do know that there is the differences between individual and collective health, but there is also the health of an individual will affect the health of the collective. So you can also see the interrelatedness of this. And we see this with our intergenerational trauma, of course. Even though my mother was in the 60s scoop, a residential school survivor, grew up in poverty, grew up with alcohol in her home and so forth, there is a connection that still harms me today, right? And all of the things that we've had to recover from growing up through those legacies and environments that trickle down into who I am today is very real. And so we're still very much reeling in those interrelatedness of that trauma. But we also have the interrelatedness of her resiliency and my grandparents' resiliency, and so on and so on and so on. We're going to talk about that. And so in our cultures, we operate from an apprenticeship model, which is where the teaching really comes from, right? So I do not consider myself an elder, yet my son, who is much younger, is considered an elder in our culture because of his apprenticeship work in societies that he's gone in, graduated, and now is even considered a grandparent to some of the people in those societies he's graduated from. So that's sort of how our age-graded societies work with Blackfoot communities. So these societies, these apprenticeship styles of teaching in our cultures develop healthy relationships and are supported through that kinship, through the culture. Renewal, sispa, is, this is what we were talking about, the same songs, the renewal of stories, renewal of rituals and songs is a very important component of our existence because, again, that ceremony affirms our Blackfoot existence. And again, I'm using the Blackfoot specific examples because this was the research that I did, and I can only speak from a Blackfoot perspective. So if we do not have our language, if we do not do our annual big camp every year that brings our societies together, if we do not have these names and we don't have these teachings and ceremonies, we will not be Blackfoot anymore. Okay, we will not be Blackfoot anymore. If we do not have the land to connect with, we will not be Blackfoot. If we do not have the animals and the relatives that infuse our sacred bundles and influence our ceremonies, we won't be Blackfoot anymore. So that is why environmental connections are so important for us as Native people, why we're all tree huggers, I guess, if people want to call it that. But it's rooted in actual, the energy combinations that sustain us for being actual Nitsitipi, actual human beings, what we refer to as our people. So these renewal processes are a huge component of what we do. Like I said, the conference is an aspect of us coming together to renew our knowledge. I was really excited to come here because I don't get to be around a lot of this good spirit and discussion. I'm usually locked in a counseling room with my clients, and that's about it. So this is amazing. It renews my spirit. It renews lots of good things for me too. Renewal is found in our adaptation. So, we talked a little bit about Darwinism. I'm going to get to that in a bit, but adaptation is a huge component of why this paradigm is considered Darwinistic, is that we actually have adapted because we found patterns in our natural worlds throughout time immemorial. So our ancestors have been doing this. We do this today, and we are teaching science to do this too, alongside us. The renewal of history and universal relationships, these develop those social constructs, important to us, important to our framework and our existence, and I'll come back to that. Renewal harmonizes the balance between all our relationships. So if I'm waking up every day to smudge and I'm asking, the first thing is thank you for, I want to acknowledge the sky, the land, the water beings, and be thankful for that food, water, and air that I've been given today and yesterday. Those are my renewal of that appreciation that I have. And those daily reminders bring that to the consciousness and guide the rest of my day, what we call a way of life. So this renewal provides that essential adaptability in what we call the order in the chaos. So our ceremonies create the order in the chaos, therefore we create the order in the chaos. When our people were living off the land pre-contact, there was a lot of chaos, and they created a lot of order, right? We didn't survive millenniums. Carbon dating is continuously updating our existence. We know as Blackfoots, we have about at least 50,000 years we've been here. Science is still catching up. But we know how far we go back because we have stories of the dinosaurs. We have stories of many different things. We were called from neighboring nations the ancient ones. So in our linguistics, we can also hear the stories of how we come to be. So lots of order that we've created in the chaos. Tsahko means the land, rough translation. Space. The space is reference for us in this paradigm. It's not time. Right? Time is not, it's an illusion as I set my clock and watch the clock. It's real here in this world, this colonial structure, but it's not in our ways. Our ways are older than what time is known as. And so tsahku means I am touching the earth and I'm making a connection. So again, we don't have noun-based languages. We would say something sitting on legs. Right? It's always a verb. It's always doing something, right? It's never just there. We don't have that concept. So the land isn't simply, it's a whole living thing, and the real connection is by me touching it, I am making a connection of having a relationship. So the Blackfoot sky, land, and water beings are what we pray to, the general gist of it. Including the stars and so forth, our cosmologies, and those interrelationships all shape the way we live, and like I mentioned some examples before. When, not where, is really the important piece of this part of who we are. That spatial over temporal reference is more important than actual when things happen. So I was told by an elder that in Blackfoot, we only have 3 days we know. Today, yesterday, and tomorrow. And maybe the day after those ones. And other than that, that's about it for the time. We count winters, moons. We have different ways. We have winter counts that we have put together as our record, written record that are pictographs of specific times of our history. So I did a modern day one for our Southern Alberta Institute of Technology, and we included the actual campus on there. We included the residential school, the cross. We included certain things that were relevant to these generations now. We included the Blackfoot Confederacy symbol, which is our incorporated sign of our Chiefs Association, because that's relevant in our journey. That's important. So things like that, we do record in way, but it's not really about time. It's more of these markers, okay? So this consciousness of ours thus arises out of our active and intimate relationships with our land. And that's why space is so important. So while it's wonderful to be here, I cannot wait to see my mountains when I get home, right? And maybe a gopher or two, right? So my frame of reference is deer, elk, buffalo, eagle. You know, if I go to visit some of my West Coast friends, it's the killer whale. You know, it's these whole other beautiful pieces of the land I have to learn a relationship with, but that's theirs. And over here is different, right? And so we all are shaped by the lands in which we originated from. And that's why this is not a pan-Indigenous approach. And I know that we need pan-Indigeneity for certain things, but when we come down to the application of the paradigm, it is very cultural specific, okay? So we'll keep talking about that. We are constantly processing our information on multiple realities. And so one of the things I think a lot of us do is if we see an eagle, what do we say? Come on, somebody tell me. Blessing, that's right. It's universal, right? So I see that eagle, I'm like, oh yes, I'm taking that into my heart. So we have we're actively processing our land and bringing it to a conscious level, right? That eagle made me feel safe at my conscious level, right? So we have that connection that influences us. And we derive those values from there. So we have ultimately land-based cultural identities. Trickster. I'm sure everybody has a trickster story. I'm sure there's a few tricksters in this room. Trickster is an aspect of the paradigm, very, very important aspect, one of my favorites, because it talks about the contrary. And anybody who likes the contrary or knows of their contrary stories in their cultures understands this very well. We all have trickster within us. We are all saint and sinners, okay? We're not one or the other. We all have dark and light to us. We talked about, the last speaker talked about going and singing to the drug dealers. That is an expression of this understanding. That even though you may be acting like a trickster now, we're gonna keep putting pathways in to help you come back to our ways. That was beautiful. That's the harm reduction I'm talking about. That's what we need to see, right? We all have these things within us. It's important to understand the Blackfoot language, as many of yours, did not have the word sin. There was not an understanding of that. That is not in our frame of reference, okay? And I will get back to that one. We did not have this understanding. It is within each of us. I love the yin and yang symbol that the Asian Chinese culture uses that describe many elements to this, right? And so we all have instances of the contrary. Everywhere you go, every culture has one. So trickster, Napi is the word for our trickster in our language. And Napi teaches us an education. Napi gets into trouble, Napi does lots of stuff, Napi does things they shouldn't do, and so we use those stories of Napi to teach our children about watching out for things like constant flux, because it's always there, it's always a potential to run into something, an adversary, or run into some trouble. Back in our ancestors' days, the collectivity was fierce. There was no way we could have survived as an individual outside of that collectivity. So our ethics were fiercely internalized. And so these stories were understood deeply. And they were stories of resilience, and they were stories to teach children morals and consequences. And so the trickster is really an element that I'm hoping to expand on more as a psychologist down the line, to really sort of enhance that we all have trickster in us. It's okay, guys. It's okay to be silly, and we actually love it. If you ever go to a ceremony, it's not a serious place like church. You're hearing somebody cackling over there and kids running around and da-da-da-da-da, right? This is trickster energy. It's with us all the time. And of course, we have Nitsitibisini, which is our language. And our language is the final construct of this paradigm. And language is not merely a communication qualifier. It is more than that in our oral language societies. Language holds thousands of years of knowledge and is expressed through storytelling. So just like our elders and the story that Robert shared with me earlier, he's sharing lots of instances, and I go and I pick what I need out of there. I'm the qualifying information. I don't have somebody else preaching to tell me what to do. It's up to me to hold all of our paradigm and to draw out the information. So that gives us autonomy. That gives us critical thinking skills, right? Lots of these skills have been stripped from us through colonization. So language documents our history, our science, culture, customs, traditions. It's a source of our identity that carries our values. Like I mentioned, the sin thing, there's no word of that. Don't even bring that into my household, right? Do not bring that into my worldview because I don't understand it. I was not raised as a Christian. I was not raised in the church. I wasn't raised, my mother was a residential school survivor, and she was sort of a rebellious person against the church, and she didn't want that to come on to us. So just like her mother didn't teach her Blackfoot because she was scared she was going to get punished, my mom didn't want to teach us those things because she didn't want our soul, our psyche to go through that, right? So I give a lot of thanks for that because I know it's not the case everywhere. So these language expressions that emerge our identity and belonging, their language is the shortest shortcut to understanding an Indigenous worldview, right? So if you want to understand Indigenous worldviews, you learn the language, and you'll have all of that there. So being Blackfoot means living the language, okay? So now we're going to shift gears, using that keeping the paradigm in mind, looking at colonization and sort of that interruption. And in Blackfoot, the crude translation of Apaskokinan is when white people came and knocked us off our path. I mean, it's basically what it is, right? I mean, I don't know what else you can say, how else you want to describe it, but that's what it translates as. And remember, these are all my elders' teachings. This is where we saw the cognitive restructuring happening in our brains, our psyche changing. We saw this world of our worldviews colliding, this jagged worldview collision, which Dr. Littleblare talks about in his writing, that talks about this cognitive imperialism, this thought that, oh, there's only one way to do things. There's one God. There's an ultra theory, and we're going to make sure you know it by force and by order. That is how it was established, to create a superficial society. And so here, the worldviews colliding are between our traditional and our Western worldviews. Colonizer is seen as the anti-trickster. So it does the opposite of what the trickster energy is supposed to do. There's a forced thought, a forced cognition to change, that we have to think these certain thoughts, speak this language, participate in these ways. We have this done through the embodiment of spiritual guardians that came forth in our lands, that then set in process this spiritual trauma that still lingers today from those spiritual guardians coming in to civilize us. there was this disconnect in colonization from our cosmology and our land, from our stars and our land stories, that then began to negate ourselves, turn on ourselves. What are you talking about? I remember growing up with adults around me, and there's probably still a few around, who say, oh, that those ceremonies are witchcraft. I don't know if anybody's ever heard that, right? Yeah, there's a few people out there. That's witchcraft. Don't you mess with that stuff. We negated ourselves. We're turning on ourselves in those cognitive reshaping. We see this colonization continue through government policies and institutions. Institutions like psychology. And you might be wondering, well, what the heck? You're a psychologist. Well, I kind of had to when I did all that school. There's kind of no turning back. But like I said, it's been a good challenge. And trust me, it's been an interesting one. So psychology is the Western response to health. And we started to see this mind-body dichotomy occur in the Age of Reason, which was about 900 years ago for Western society. And at this time, Judeo-Christianity was the supreme reasoning of the day, the ultimate power, ultimate knowledge. And we see what's happening in the States right now, which is fascinating for all of us who are paying attention, this whole emergence of patriarchy, right? The women are just getting a little too strong. They're going to overturn this system pretty quick. No, let's squash them down some more, right? Take out all the EDI, DEI stuff. Let's get rid of the brown people again. Okay, so all this pullback because of this wave of wokeness, which simply means we want to do better by each other, right? So we want to be good to people. So we see at this time of psychology and the growth of it, this form of biologicalization, which was this sort of objectivity, and I say quote unquote because there's no such thing as objectivity. And from Indigenous research perspectives, we know that we had to establish those Indigenous research methodologies because we know we're not objective. We come with all our wonderful subjectiveness. I come with spirit. I come with these lenses I look through every day. I come with my trauma. I come with everything. So there is no subjectivity. That is not a real thing. I love the takedown of academia right now that's going on. I've always loved it. It's great. There we see scrutiny within psychologicalization. So always scrutinizing something and reducing things to terms like health, mental health, the body, cells, etc. So reducing these down, not to see us as the whole person. So it becomes very distant from a lived experience. And we see the removal of those spiritual ethos and environmental relationships. Within the psychologicalization, we see the spirit removed. We see the deep human experiences have been removed historically. We see this lactification of knowledge, so this whitening of knowledge, making it palatable for the academy to swallow, okay? Forget about us. So that's why when I looked at the standardizations of assessment tests in psychology, they're standardized on white middle-class privileged children, young college students, okay? That's not reflecting of the clients I work with in First Nation communities. Okay, that has no parallel. Maybe a couple spots, but very far tools that are not, there's a bias there. There is a growing distrust in counseling. I have many clients who come to me the first time and say, wow, I don't have to educate you. I trust you. I see your skin, I see you, okay? Instant rapport, instant going into deep stuff. Hard on me, but it's good for them, right? The work is deep. And so people like myself and allied counselors who really make an effort, we work to build that trust back in counseling. And so for these reasons, it becomes very difficult to accurately diagnose one of our people. Eduardo Duran, his work, he's been in the States, and I started sort of looking at him in the 90s. And he wrote a book in 95, still very relevant, Post-Colonial Impacts of Psychology, and then his second book was Soul Wound. And he just does a really great job, still relevant stuff. So when we look at mental health considerations, we're looking at the result of colonization, and that our maladaptive behavior, so our inability to sort of adapt with societal norms, is because of colonization itself. So it's kind of an interesting conundrum there. We know that our health was intact prior to contact. We know settler and explorer journals referred to us as people of God, because our health was so superb, so beautiful. We didn't drink milk, but we ate bone soup. Okay, we got our calcium elsewhere. We're the only society, we're the only group of species in the world that drinks dairy after infancy. Okay, so stop. Just kidding. I'm a buffalo person, not a cattle person, so that's why. We look at Dr. Maria Yellowhorse Bravehorse down in the States, amazing psychologist for decades, and she termed historical trauma transmission. We call it intergenerational trauma, but she just talks about it being an individual psychological wounding that has intergenerational epigenetic effects, that there's a group trauma element here of the experience, and that really having an inability to cope because our original coping mechanisms, like in the paradigm, have been disenfranchised. And today we have these harmful colonial modes of care that we're still trying to correct, and the previous presenter did really amazing of talking about some of those. The stakes being so low in our communities is why we see some massive issues, pathologies we're dealing with. We're not in communities where we have even sidewalks for kids to rollerblade on, or elders to walk on with their walkers or wheelchairs. We don't have those privileges. We have gravel and dirt roads. We have our beautiful little res dogs, yes, but sometimes they can be a little dangerous. So we just don't have the amenities that every Canadian child and society member has in their communities. We have an active state dependency. And so what this means, it being active, is that there is lots of research coming out. If anybody hangs out with those economic development peoples, you know, you'll hear some of their stories, which is great because they're bringing them forward now in our Indigenous spaces that talk about the historical state dependency efforts Canada and United States have put into place by cutting off our economic growth, making it difficult to get licenses, and everything you can ask for, getting on grids, electricity grids, selling your electricity, all sorts of issues. So we still have those. There's a reason for that, and there's a book called Pedagogy of the Oppressed by it's not Frantz Fanon, is it? Friere? Okay, so that one's really important. That talks about keeping people illiterate and keeping them poor means that you can control them easier. Okay, so this is why there's an active state dependency. Well documented in Calvin Heelan's book, Dances with Dependency, Aboriginal lawyer out of BC. So good stuff. Poverty creates poor health. And we have poor health, and we have restricted access to our rights and resources to get better. So these are some of those active state policies. It makes it very difficult to treat complex intergenerational trauma, and we have a lot of pathologizing of Indigenous clients, like I had mentioned in the previous slide with the psychologicalization. So lots of pathologizing. I've read some case notes from children's services workers, lots of low functioning, right? I heard somebody talk about IQ earlier. Well, whose IQ version did we use, right? So lots of issues there to treat, lots of pathologization, lots of saying, oh yeah, they're just, basically our stats are terrible. So to me, those stats indicate a racist system. They don't indicate who we are, okay? So remember that going forward. Those stats indicate racism in those systems, okay? Of these institutional violence systems. So our heaviest hit are people what we refer to as those who are culturally blank. And We often see this in our younger generations, unfortunately, and that's why I work very hard to work with young people in my practice, to overturn and challenge their life trajectories. I have 2 clients that come to mind that tell me, I didn't plan to live past 25. And after working with them intensely on their trauma, they're going to New Zealand for school. One's going in flight school in BC, okay? So that's everything to me, right? That's the biggest I could ever ask for. So they're the heaviest hit. They're struggling hard today, and we have to be compassionate and remember them. We see the heaviest hit in institutionalizations, the jails, the pain industries was what they're referred to now, sadly. I heard that called a while back, the pain industry. Jail, child welfare, health. Okay? This is who fills these systems and who puts money on the table, referred to as brown gold by some people in the industries. We fund people's mortgages, et cetera, in this institutionalization. So there is an active agenda to keep these things in place. We know that this is an intergenerational issue. There's a rejection of self and spirit, loss of identity, almost a nothingness to many of people without having any cultural connection. They're absorbed into colonial identities, so we wonder, why are our kids going off and wanting to be rappers? Why are they wanting to be gang members? Well, they're accepted there. They're open arms there. Yeah, they're not the best places for them to end up, but they're getting a need served, right? So they're adopting these identities. They don't want to be the Indian, they don't want to be the cowboy, right? So what else is there to be? I want to be an Indian. But we have these cultural confusion that really arises out of this, and I think it's really important we talk about that as we move toward the next stages. But here we've seen the loss of regulation strategies and behavioral life skills and a learned sense of helplessness. So when we're talking intergenerational welfare dependency, this is largely what we're looking at, okay? So, matas tsistapi, api, see that word again? That energy? Making things up is where we're at in many instances. And so this element of cultural confusion is very important to me because I grew up around very specific and careful elders. And yes, they have to be strict in some instances because they're protecting what was given to us thousands of years ago. And they say, you pick one way or the other. You want to be Indian? You can come this way. You want to go be something else? You go be something else. But you make a choice. And I like that about them. They force us to do that. You know, people do mix. They carry both. But those were my teachings from my elder. And he was strict. But when we don't have those cultural apprenticeships, we don't have the cultural ethics. So now one of my elders who's gone, he talked about, some knowledge holders claiming to be knowledge holders, kind of just adding water. Just add water, and I'll be instant, right? And so this is where we're at in some places because of the disconnect between knowledge holders and community, because community keeps knowledge holders validated. We validate who has what and who knows and who has the right to speak. So this break now in our communities, we see this loss of lifelong learning that influences those traditional wisdoms and intimate knowledge. We see the loss of accountability to communities. So I live in Calgary. I go back home all the time. But I see a lot of people in Calgary pretending to be knowledge holders from back home who have no business in those spaces. But because we're compassionate and kind, we just, we'll let the people in authority who's supposed to take care of that know, and they'll do what they need to do, right? But it's not my role to do that. So we see this level of internalized oppression, disregard for territories. When in Rome, what is that saying? When in Rome, do as the Romans do. That's like us. I'm not going to come here and start having Blackfoot ceremony, right? I would never be that disrespectful. I would come and learn and participate and listen, Okay, so that's our protocols. I don't disregard that. We see this constant pan-Indianism that we just can't seem to get a hold of. And now we have pretendianism, yay! I just listened to Restoule from Ghost Warriors last night. She did a presentation to my national board, and she killed it. So really amazing presentation on pretendianism, and I'm so grateful for people like her who are out there doing that hard work, because we know we all get upset about it, but do we have the energy and ability to do that? No. So we need her. We need those people, right? We need our advocates and our activists. Heard a lot about lateral violence over the last little while, and really important. If any of you want me to come out to your communities to ever do work on these things, please let me know, because I go into these much more in depth, and each one is in itself its own teaching. But lateral violence is a huge one for me. It's the very cusp of colonization to divide and conquer. Okay, keep division in. I use the analogy with my clients when I find them being self-abusive or calling themselves down. I said, oh, you're taking the whip now and you're just whipping yourself, aren't you? You know, like the colonizers left and now we just do it ourselves, right? We're trained, that cognitive reshaping has trained us to be self-abusive, to negate the self. And so the 5 faces of oppression from Iris Marion Young's work is exploitation, marginalization, powerlessness, cultural imperialism, and violence. We heard a lot about that through this conference. We did talk about exploitation, human exploitation, right? So I'm so grateful it's being talked about. It's taken so long for it to reach the headlines, decades, right? Decades. So these are the faces of colonization. Intentional environments of injustice, like I mentioned, keep the people illiterate so they're more controllable. Why do you think our education is unregulated the way it is on reserve? It's not at par with provincial standards, and so on and so on and so on. There's just so many things that we face. This negation of self disrupts us internally, of course, keeps us to adopting colonized views of ourselves. We're not worthy, we can't do it, just give up, just join. It immobilizes movements, okay? So, where does this all end up? We've talked about that in the end, from all of this research, from us knowing, and the research just validates what we've known, is that our spirituality is mental health, okay? I may be a conduit as a therapist in that room with an individual or a family, but I don't hold everything for that person's universe. And I'm not gonna force my views on anybody. If they ask, there's a window for me I get to have there, right? But it's ethically, I can't do that. But I can do that here, okay? I can share this here, that spirituality is mental health for us, and that decolonization is on that spectrum of Darwinism for us to stay alive. Atsimoiskan is roughly translated as prayer, but in a deeper meaning, it is, we are trying to build a relationship around and with those of creation, with all of my relations. If we are in relation with those beings, we are trying to get them to do us a favor with their powers, okay? So this favor is to shift energies to the positive, kind of like CBT, cognitive behavioral therapy, right? I always look at that like that. So we're trying to shift. We're praying it back. We're praying things back, the spiritual revolution that we're having now. It is intentional and it is purposeful is what we're seeing. We're seeing spirituality in place for recovery of our genocide, residential school impacts, and generational healing. We are learning to be Nitsitapi again. And Nitsitapi is what we call ourselves. We don't call ourselves Blackfoot. That is what somebody called us, and I still don't know why we're using it. It's because somebody saw the bottom of our moccasins burnt, and they called us Blackfoot. Okay, but we call ourselves Nitsitapi, which means the human beings or the real people. Okay, and I know you all have a same word for that in all of your languages, as I've talked to a lot of people across our lands, and various similarities. Our individual healing, people look at this stuff and say, it's so mammoth, where do we start? It starts right here. It starts with us at our table every day, with our kids and our family and ourselves. And then we can add to a positive collective healing when we are healthy and clear ourselves. Okay, so it really is back to that individual health. And it's generational health, not wealth, is what we're creating right now, which is wealth to us. And our youth are unapologetic, and I love it. I was in Montreal last month, and with a group of artists who just did an amazing, Inuit artists who did a beautiful show, which is, the seal that I'm wearing represents some of that work I do. And we were in an Uber going to the restaurant, and we heard Tia Wood come on and her song, and we're just like, and they're like, she's famous. And I literally cried about that last week. Okay, I was walking and I was like, oh God, these kids, they make me so proud, I'm that person. I cry when I get happy, excited. So I might cry today, but I'll do my best. So our youth are unapologetically doing this. If anyone watches social media and TikTok, you will see them just kicking doors down and having that generational strength that we've infused in them to do what they're doing today. So shout out to our young people. Spirituality, yes. Spirituality is a health cornerstone. It's a keystone part of who we are that creates proximal relationships with our cultures through our lands. There is public and sacred knowledges, and we have to decipher how to use those. And again, I don't have authority to speak on sacred. I'm only speaking on what's been out there. As my elder said, everything I'm teaching you has already been written about. So if you get into trouble, you tell them that. And that's usually just in Blackfoot territory. Severing connections with spirituality has harmful impacts, okay? And grappling with confusion of spirituality is something that we're still struggling with today. So embodiment of spirituality, and what I talked about with the thesis, is that we are co-creators in our healing. Okay, spirituality doesn't mean a passive, I'm gonna pray and hope something gets done. No, that's a part of it, but I also, like I say, the buffalo didn't come and fall right in front of my teepee, okay? We had to go find it, and in instances we had to pray to find them, okay? So they're hand in hand. It's not a passive way of life. We do this through ritual and ceremony. We talked about the importance of that, and we talked about it shifting energies. The transfer of knowledge is important. Apprenticeship is a part of that. These are interactive kinship models that provide evolving capacity through these ways. And that Blackfoot sacred knowledge encompasses a comprehensive education. And every time I use Blackfoot, I want you to put your nation in those. And not that you use the words or things, but you have a same system of doing these things. In our reference points, in Blackfoot creation, Napi-Nat-Dusi is the sun, the old man, who represents the source of life. And Gokomagisam Gipitaki, the moon, is the old lady who represents compassion. Their son, Abissawat's morning star or Venus, and mistaken morning star went to the spirit world and came back with the Blackfoot prayers. These are the beings who the Blackfoot people pray to. So when I'm praying, I don't have a connection to a Father, a Son, and a Holy Ghost. I don't know what that means, but I do know what this means. I do know what the sun and the moon, Abissawats, I know what those things mean, okay? That's my reference point as a Blackfoot person. So prayer, in our ways, is a living expression of this native paradigm that we walk through that holds ancient traditional knowledge. And decolonization is always accessible within this Blackfoot spirituality, within your spirituality. So as we move to closing, the intersection of the native paradigm and Darwinism. What is Darwinism? Simply the ability to exist with adversaries and have to adapt, the survival of the fittest. Yet somehow, in these evolutionary spaces, they never talk about us. I never hear them talk about First Nations, Inuit people. And I'm like, well, we're still invisible, right? So I use this Darwinism to sort of get at those scientists and say, hey, you guys need to look, like, you know, you're missing the boat here. So the intersectionality lies within land-based ecological cultures that we talked about and the relationships with those cultures through this advantageous traditional knowledge that has kept us alive. It is purposeful, practical knowledge. We're not frivolous with our research funding. Still today, we use research funding for very practical things as Indigenous people. We're not out there studying, how do I get this to a different color or whatever, I don't know, just something ridiculous, what I call frivolous. We never have that privilege. We always have to be practical. We have a fierce internalization of ethics based on these relationships with the environment that promotes our collectivity as people, as working together, that instills within those decolonization movements. And we know the movements we're talking about. A lot of, like I said, while we're sitting here in a nice space, our frontline activists are out there defending our lands, and we need them, and we need to support them as much as we need to support each other. So we need to remember that, right? Yeah. And so this is seen as a developmental health framework. So Darwinism, evolutionary theory, we know science is catching up to our traditional knowledge, and that this, like I mentioned, the evolving carbon dating is validating what's already known. You can look to some of the grandfathers of native science. If you haven't, Dr. Leroy Littlebear is up here. Dr. Gregory Gayeti is down in the States. I believe he's Navajo. And in Blackfoot, we would say, "Ikakimat," keep trying. You don't give up. Keep going. Try hard. And Elder Carol Murray, one of my 4 elders that I worked with, she said that our ways of life challenge the colonial mind, and this is strengthening the weaker parts of ourself. And so just by simply being in the presence of our ceremonial, sacred societies and cultures, it is going to help strengthen the weaker parts of ourself to enjoy all aspects of our life. I'm going to just whip through these last slides because we're almost done. We have these shared experiences. Again, you're going to get the PowerPoint, you guys. We have these shared experiences that bond us. We're not homogenous people, right? We have some shared experiences, but we're not Pan-Indians, okay? And I do take insult to that when I'm lumped in that, because I'm a proud Piikani Blackfoot woman. That's who I am. I don't know the Cree way of life. I don't know the Soto. I know a little Sioux because I had a love adventure down there. But I don't know it all. I got a love child. You know, but it's not who I am. This is what I know. We can only speak from where we know. That's the teachings of revitalizing our cultures, okay? And so these identities, we're still in full force. Our advocates are still out there. We have these very common experiences. We know that there's resurgence happening right now. We know that every year I attend the big camp, translated as Sundance. It's not a Sundance, but that's what people lumped us in, right, who were looking at our culture. It's annual, it's called the Big Camp. Every year I go, there's more people. Every year I go, there's more young people getting inducted into Ginatsu Mitaks or Nipo Makiks or the Young People's Society. That is a data. That's data to pay attention to. So I collect data, but I don't look at data like Western researchers. Okay, I'm not clocking it like that. I have a very different view, which informs my expertise, my actual participation in the communities. Elders are more in demand than ever. Shout out to our elders, you rock. You know, we need you. We need to uphold our elders, take care of our elders, because they provide the apprenticeship for these models. The restoration of spiritual confidence we see. This is why we see our young people kicking down doors, because they know who they are. They know. I call it being bulletproof. Once you get invested in your culture and your language and your ceremonies, you know you are protected. You know that. And so that gives my sense of spiritual confidence so much height that I feel I can do a lot of stuff. I'm not going to say everything, but I feel pretty confident to be here today. We got to heal the fight in the fight, flight, or freeze. Okay, we got to help our activists and our advocates because we get stuck in fight. And there's studies now that the amygdala is growing because the fight is so big. So our brains are changing, okay, because of this trauma. So we have to heal that, and we have to support them, those people who help us with the movements. So fostering these spiritually informed therapeutic environments, using the paradigm, I'm not saying that therapists are the spiritual conduits themselves. We're often just, again, a liaison, but we can prepare spaces to be therapeutically supportive by providing this interpretive framework we talked about, identifying the trauma. I'm not going to go through all of these because we're pushing past our time, but we could talk again more if you want me to come out to your community. Increasing the success through the paradigm is using this as a decolonization health model. It is very cultural specific, like I mentioned, no pan-indigeneity here. This is a resurgence of our traditional values that will develop our whole communities. For our national, international movements, we develop, and I'm disseminating this information, and again, I put culturally specific twice, sorry. I was up late. But again, going back, just closing, the sovereign mind is really what I'm about, okay? Because we're sovereign people at heart. This is who we are. We don't have to ask for rights. You don't ask for a right to use your right, okay? You just do it. And so I'm here to give the message that despite research not, sort of taking some of these things into their spaces, not being considered best practices, not sort of disseminating that in academic journals, we don't need to do that. We already have this knowledge here. We don't need to ask permission to do that. You can lay this foundation anywhere, and we can access decolonization anytime. It is with us all the time. So my hope is that we continue to build the sovereign mind, that our people carry heavy, heavy burdens that non-Indigenous Canadians couldn't walk a day in our shoes, okay? They couldn't, for the work that we do, and all of you that are here because you're coming to get good things to go back home with. So we carry heavy burdens for our lands and our community, and despite these harsh realities, we continue. We are Darwinism. We are the best practice. And so we want to be able to reconnect to those sovereignties, and each tribe will determine what that is, but we know that they're grounded in the spiritual ethics in relation to the land, and that's why we protect our lands. And so our health inequities disrupt our sovereignty. We can turn that around. Our outcome, my hope, is to reconnect with the traditional mind, the Blackfoot mind. Again, your culture, put the insert there. To have increased sense of control and autonomy. To have prayer to increase personal intimacy and honesty. To have healthy coping mechanisms and healthy identities. To have purposeful consciousness, to use the consciousness, not to clock out, to be unconscious, which is what we're seeing a lot of people want to do. To have healthy homeostasis, balance, actual physical regulated health and harmonization, solidifying our values, and that the potential is always present. So that is it for me today, folks, and I just thank you for listening and giving me the time.
Thank you very much. That was, I think just so in line with so many of the things you've been learning about. Yeah. But I really loved how you really articulated the strength that comes from that work and the strength that comes from knowing ourselves and truly being our authentic selves. So you're such a great example of that. Thank you very much. Thank you. We only have time for one question because we're getting into our lunch break. But does anyone out there have a question for Angela? No.
They're all hungry.
Yeah. Yes. Okay. There is one there I see in the. Thank you.
It's not really like a question, but how do you say I don't know in Blackfoot?
Matskinip.
What does that mean?
It's sort of like Matskinip is, I don't know. And Mataguiki is similar. It means it is what it is. And so we use that a lot. And a little gem I'll leave you with as a psychologist, when we cannot accept something, we suffer. Okay? So let's accept where we're at, but let's also accept what we are, we're a part of. But when we don't accept our suffering, when we don't accept our limitations, when we have expectations and we don't accept a person's responses, we suffer. So accept them all, accept everything. Go there and you'll have a lot of peace.
Thank you so much. Thank you.
Thank you, everybody.
And now it's lunchtime, and so go out and grab some food if you haven't yet. And we're going to begin the afternoon program at 1 o'clock.
Kia ora, everybody. Those of you that were not in the haka and poi workshop, you're in for a treat. Those of you that were in the haka and poi workshop, 2 minutes, and I'll see you up here. Thank you. Actually, 1 minute. If you're in the haka workshop, 1 minute, and we'll get you to come over and start making your way to stage, please. You can get back to lunch once we're done here. Let's go.
Kia ora.
Haramai e te whānau, haramai, haramai. Come on up. My memory is saying that there's a couple out there who are meant to be walking up this direction. Yes, I can see you trying to duck your head right there. I know you know I'm looking at you. Yes. Funny story though, it's actually really bright up here. I can't see past the lights. Haramai e te whānau.
Hi. Hi.
Oh yeah, you guys. There's the words there, te whānau.
We're gonna be performing.
A tēnā tātou katoa, e mihi ana ki a koutou e noho nei, ki raro I te tuanui o tēnei whare. Just to let you know, this was the crew that came with us to do a bit of a haka workshop, and we're here to present the haka that we all got, well, that everyone got to learn, as a gift for everyone else at the conference. So before we say, yeah, homai te pakipaki, give us a clap, give us a clap. And if you wish to, there are words around. I don't know how you'll find your way to join in with us, but we're here for you. Kia rite. O tēnei paua! Ko te puru, toa toka, ka ue, ka tū, tanga, I teriri e kore teriri, e koi mati, koi para, ka puta waiti, kia toa, teriri e, tai rua, toru, pukana! Can we get a bigger round of applause for that, please? Yay! Tēnā koutou e te whānau. It was lovely spending the afternoon with you. Thank you very much for sharing this haka with us. Kia ora.
Thank you. I hope everyone enjoyed their lunch. I think the food has been amazing here. Hey, did you guys go for the steak or the salmon or both? Smart. Yes. I feel kind of bittersweet about this afternoon, honestly. Still excited about the last panel, but also feeling a little bit of sadness that this amazing time we've been able to spend together is coming to an end this afternoon. But I just want to thank you all for being, for really kind of helping to create the space that we envisioned at the outset, a safe space for learning and for getting to know each other, but also learning more about this journey of getting to know ourselves. And I think this next panel is really going to continue to add to those teachings for us. The Wisdom Weavers Storytelling and Traditional Teachings is a series of storytelling presentations on enduring troubling times, surviving challenges, keeping families strong, and emerging stronger for it all. Elders and knowledge holders from across Turtle Island will share their experiences as well as stories within their own cultures and nations. Please join me in welcoming Basha Blondin, Diane Longboat, Donna Augustine, Dylan Corshane, Kevin Deere, Mike Lerma, Pete Gishane, Peter Wynn, and welcome back to Anishinaabe Health Toronto's Interim Executive Director, Michael Millward, who will be moderating this panel. Okay, let's give him a round of applause. Come on up, everybody. You get to sit on these comfy chairs.
Huh? Anywhere. I hope Pete Gishane can join us. If anybody sees Pete, please ask him to head up here. Thanks, Donna. So I just wanted to start by saying that when we were watching the video clip on Tuesday evening, where it was little snippets of the folks here talking at their storytelling presentations, I really loved seeing it because I've really grown to love these people that I was able to work with. And I was very much looking forward to seeing you today and being able to talk to you because meeting with you has been such a blessing for me. And I think of this time as my teachers coming back to spend time with me. So I wanted to thank you for that. To start the session today, what I'd like to do is actually read a quote from Joe Hester. Joe said this on the first video of the series, and I remember I really had to talk Joe into appearing on the video. He just refused, and he's a very humble person, and I just begged him, please, Joe, just a few minutes. And so what I'm going to read now is what he said on the video. My traditional name is Talking Fox of the Bear Clan of the Cree Nation. This project that we have been working on is called Wisdom Weavers. It was born out of a conversation that I had with a fellow staff member as we talked about the difficulties that COVID had exacted upon our community in Toronto. we thought it would be a good idea to search back into our culture and see how that would help us in getting through this health challenge of COVID. That idea presented more of itself in the idea of collecting stories of our past through our traditional healers, elders, and leaders of our community. So with that, we started on reaching out to our elders. One of the traditional people that we reached out to was Diane Longboat, who is of Mohawk people and the Haudenosaunee people. So she heartily agreed to participate with us. So as we move from one story to the next through videos, Diane has not only agreed to provide a story to us as well, but to introduce the traditional people, many of whom are Diane's colleagues, who will be sharing their stories with us. When we think about our culture, oftentimes, these stories are conveying to each other and the people through stories. I can recall my own experiences as a young person listening to my grandfather tell stories in the language that I didn't understand, but my dad interpreting for myself and my brothers. It was a time to share and to be together and to learn different teachings, different wisdoms, but certainly conveying who we are as a people. I think storytelling goes to the heart of that, and hopefully you will find part of yourselves or all of yourselves in these stories, and I know you will enjoy them. So, when we started the project, as Joe had mentioned, we reached out to Diane to ask her for our help in getting the project going. And one of the things that Diane was so generous with was sharing her lodge with us for filming most of the segments or of the video series. And I wanted to ask you, Diane, I'll say that Diane has been so generous to me as well in inviting me to participate in ceremony at her lodge. So I have great love and respect for you, Diane. I wanted to ask you, Diane, would you speak to the work that you do in your lodge, which is called Soul of the Mother Lodge?
It's working. Well, thank you so much, Michael, and warm and loving greetings to all the elders who are here. What an honor for me to sit on the stage with all of you. I would say that Soul of the Mother is a healing and a teaching lodge, and nothing that I've ever done in my life has been a result of, I want to do this, or I think this is a good idea, but it was always a call of spirit. And so it was in 1994 when the Buffalo came to me at a critical moment in my life when I was actually dying. And what she said to me was, the life that you've made for yourself here, which was Toronto, is over. You're going to return to the community where you were born and light a fire of peace. And to that fire, the nations of your people will come for their regeneration and revitalization and deepening the beauty of what they already hold, but feeling like the essence of the Creator's presence through that sacred fire. And so it was. That dream came in January of '94, and by August, I had moved home. 2 weeks after I moved home, one of the chiefs had passed, and his wife came to me, and she was in such a deep state of grief that she had a hard time speaking, catching her breath and speaking. And so we went outside, we lit the fire, and it was, the work began from there. And so it was always a journey of spirit. And the other thing was that, that we should all know is that we never work alone. We work together. And so in that vision, I was also told by the Buffalo that the Creator would send the strongest warriors to stand at that fire. Not because they're serving me or seeing me as a leader, but because that fire is part of their own visions. And so the people who I work with at the fire today, we call them the Council of Soul of the Mother. And there are 5 of us, and we've been together for 30 years. Nyawa.
So I often hear you speak about your family, meaning your wife and 4 daughters. Some of their names I won't attempt to pronounce. In your presentation, you focused on the stories and teachings about the 4 gifts given by Creator to each spirit being. These 4 gifts are spirit, family, language and voice, and responsibility. These 4 gifts make up the identity of each spirit being. Dylan Corshane, would you share a story on how we can express gratitude to Creator for these 4 gifts?
Bonjour, Anin. Miskobenesi and Nedishnikas, Mekanak, and the Nawe Magan, Saging and Dunji. Greetings. First off, miigwech for allowing me to be in this beautiful territory of Toronto, such a big, magnificent city with amazing people. First off, one of the things that I thought of when when the tobacco was passed to join the series was our young people, our youth. Our young people are out there questioning who we are, who they are. As I created and began raising my daughters, we broke cycles that were led by intergenerational traumas. And because of that, I wanted a better path for my children. And a part of learning, a part of sitting and visiting with elders, this teaching was given to me by my grandfather. These 4 gifts that Creator gave to our people, that Creator gave to all people, all nations. And that's a spirit, a family, a language, a voice, and a responsibility. Of these 4 gifts, they make us whole as one. So sharing this teaching and bringing this teaching through this video my intent was to help others find who they are, to begin that work, to begin that process of finding spirit, finding family, looking within the spirit, within the body to understand who we are. For young people, it's important, it's life-changing, it's life-saving. My life was saved through that Nishnabé Matizu and that good life. And so sharing this teaching, this tobacco, and passing that teaching, that's what it's about, teaching and sharing with our young people. So I don't want to take up too much time because we do have only 64 minutes left. And I'm the youngest on the panel, and I would never want to take any opportunity away from an elder and their teachings. So miigwech for hearing me.
So like many people here today, I grew up in an urban setting, Saskatoon, and then Regina. So I know what it means to be a city Indian. Pete Shane, in your presentation, it was mentioned you were raised in an urban setting, Regina. Would you share a story about yourself in terms of your journey of being raised in the city and now being a traditional healer at AHT? It seems like a long journey.
It's on? Oh, good. Good. Cool. Wow. I guess to reflect and just to reflect on what has transpired and what has occurred here in the last 3 days. And the story that I shared was shared to me a long time ago by my grandfather, prior to moving to the urban setting, I guess. And I was very fortunate to have my grandpa and my parents share that part about the culture and the traditions and the values and how important that is. And even the language itself. I don't speak the language fluently. When I was young, and being around my family and the community, I was able to speak some of it. And so the teachings that my parents and grandfather shared with me, one thing that he did share is that your life's going to change. It's going to be different from mine, he says. A lot different. And I didn't know what he meant. I was very small at the time. And I always tried to, and I was always trying to figure out why was he sharing these teachings and these stories with me. And just like in my life, it was always filled with riddles, never a direct answer. And he'd always say that one day you're going to understand and you're going to know. And it's going to be a hard road, he says. It's going to be a challenging road. But always keep in mind, he says, who you are. You're Anishinaabe, he says. Remember where you come from, who you are, he says. And I try to figure that out myself. I was kind of a rebel. I was, want to break rules and taking it to as far as I can, I guess, in a sense. Right? Either, and Grandpa used to say, there's an easy road or a hard road, he says. I chose the hard road. And I think that was sort of a metaphor for me to get a better understanding of who we are and the challenges and the difficulties we face as Anishinaabe, with barriers, stigmas. And the stories that he shared with me were very comforting. Obviously, I faced those challenges when I moved to the urban setting. And I was one of 2 Anishinaabe people in the system itself. And I began to understand the challenges that my grandfather faced and my mother and my dad, especially my dad, being in residential school. So we had to fight for everything in the school system itself, not only the kids, but the teachers as well. Because they labeled me as a slow learner, which I am today, I guess, in a sense. And I never liked school. I think it was the way they taught it, the English language can be very confusing. Our language, it has so much substance in it. The language itself. You know, when you say Anishinaabe, that talks about myself. This is who I am. And stories in our journey, that's what we're about, stories. Stories. We all have a story. By just reading the cover, we don't know the full extent of one story and the impacts that was created. And in that story, we try to find the value in our stories sometimes. And we all seek in the same thing. We seek that understanding, that knowledge, that love, that respect, to voice our truth. Because at one time that was silenced. We couldn't speak our truth. We couldn't voice our thoughts, our opinions, what we want, what we needed. And it can be a bit challenging, even in today, living in a big city like Toronto. And that story my grandpa shared with me about a serpent in the water and that boy that was taken down into the depths of that water reminds me of how precious family is, how precious community is, how precious we all are in life, and how much we can give. Little I know that I'd lose my boy. I lost my son at 28. And I was a traditional healer at the time, doing the work. I couldn't save him. I lost a grandchild. My son's boy. Couldn't save him either. But I gave it the best of his 28 years to my grandchild as well. And I was saddened by it. Still today, I live with that loss each and every day. I live with the loss of my grandpa's things that he couldn't do, couldn't accomplish. But I think the greatest thing that he ever gave me was that ability to express who I am and be that rebel and to share that understanding of what relationship is, what family is. You know, identity is important. When I got my name from my parents, when my grandpa taught all these values and these things to my mother. I have another twin brother, Saskatchewan. And the man that named me was blind. The name he gave me was Kwatamabit. The Dishnakas Wapshishidudam. I understand that name. I understand my role as a Martin and where it fits in with the clan system. I'd done all those things when I was a child. A provider that gave everything with love to his siblings and having to grow up so fast. And I think that's why I was a rebel, because I had to grow up fast. And that old man that named me said to my mom, one of these two boys are going to know something. She didn't know. He didn't know who. My mom didn't know who as well. Fortunate it was me. And I didn't like it. I didn't like responsibility. But I embraced that responsibility that Creator has given me. The way I look at it is not today. I owe my life to Creator. I owe my life to the people. And there's certain protocols when I took on this role. Who am I accountable to if I take on this role? Well, for sure it's myself. It's Creator. It's my ancestors. It's my community. When I thought about it, there was about 8 different things. That's a lot. I had to sit with that. That's a big responsibility to be accountable And I ain't gonna, I make mistakes. The way I look at it is I'm a spiritual being having a human experience. And I do make mistakes. But the one thing that I really true value is that Creator blessed us with our first family, which is nature. Everything in nature is here to guide us and help us. It's like our medicine chest, I guess. What's our biggest downfall is sometimes just being that human and questioning our own abilities. A person once asked, these young guys were talking at a sweat lodge of all the places they've traveled, things they've done. And he seen an old man standing outside the sweat lodge. And he asked that old guy, "What's the farthest place you ever traveled?" That old man says, "From here to here." This is where our truth lies. This is where the love lies. This is who we are. This is where our values lie. This is where our teachings rely. Just because we never grew up with the culture or the tradition doesn't mean it's not there, because it is. You're part of that big story. So when I shared that story, it had a lot of meaning to it, for me anyway. Because we never take anything for granted. And I remember growing up, the old people would come to my grandfather's house just to talk. And they would offer sema. They didn't want nothing in return. My grandpa would give them tea, and they'd sit and chat. That was that mutual exchange of respect and understanding. So there was a lot of content in that. For me, it was a lot of content in that story. It had some personal things in it. Like I said, growing up in an urban setting, I guess I had to learn the other side of that road and that path. And run myself through the ringer, I guess. But I really give thanks to my ancestors. I give thanks to Creator. I give thanks to all these elders that are on stage here. I give thanks to all of you that participated in this three-day conference. And hopefully you can take something back and share that story with yourselves and each other and apply it. And at the end of hopefully someday, I'm able to see that full story of what we've achieved for our communities. But also remember, ceremony is a big part of it, and sharing stories, and sharing those stories. So sometimes I like to babble, so my wife gets mad at me, so I'm gonna close it off here, and miigwech, and thank you for listening. And I thank Diane for that gratitude of coming to your territory on the Grand River. It was truly awesome, and I'm looking forward to more stories of sharing of culture, spirit, and hopefully at the end of the day, when I'm done here, I can empty my plate and fill it with more positive, and stay humble, and I try not to allow ego to be part of my journey. So miigwech.
Thank you, Pete. In a presentation titled Giving a Spiritual Inoculation, the presenter asserted, we're at a crucial time in history where Indigenous wisdom of this land is rising up and prophecies are being fulfilled. The prophecies say a time would come where we would help our brothers and sisters that came into our house to wipe their tears so that they could see different, open their ears so they could hear different, to remove the lump in their throat so that they can speak, and together we will put our best collective thinking forward for the benefit of those future generations coming. Kevin, dear, your comments are timely to what the Canadian society at large is facing now. Would you help us understand how to apply your teachings of giving a spiritual inoculation to what is happening in and or to Canadians now?
Zinitu gaizu esoma nizarada. Agwego wat kun waradu. Ziniji dakana raja. Agwe yugo da garide wadu skana ayugunu tanyu. Nono dasha dorete o gadeno jere zitiniot. Nezi zinizi chutaso jim zade zinyor nizarada. Nahoda da wana dunku yetini stanhu za sayo got kama haja agwego nahoda yugotsta chata nizarage danu yatana jodakte. Nona da satung gauru ana ganohoda garunyu agwego seguna ne tunizi rodio tajanioni. Tanu gonek kari wanota na chata nizarage wanak zidaya da wadan waradu. Jatkugi wadaki agatrori nahoda igre ayuga nigura yadane nizarade kadena yotane nigura. So I start out by welcoming all of you that are gathered here at this particular moment in time. As I'm looking around, we're all seemingly in good mind, good health, good spirit. And when we ask ourselves, why is that? Well, in our creation story, all of the things that we need for us to enjoy and love this life, nothing is lacking. Everything is here. Because there's a relationship that happens with this lower world and the upper world that's referred to as extended family. And all we need to do is to have an attitude of gratitude. And that all gets expressed through our ceremonies, our songs, our dances, and all of those things that we're lucky. Today, even myself as a Mohawk, in our longhouses, that our languages, our ceremonies, our songs, our dances are still full and complete. Because there's a narrative that said that in 100 years, that's all going to be gone. Because we'll not have to, meaning the settlers that came to this land, have to deal with all of what has happened, because there'll be remnants, there'll be descendants, but the real McCoy, they'll be all gone. But that didn't work out, because look around, we're all still here. Our languages, our songs, our ceremonies, our history, our creation stories are all intact. So I talk about a spiritual inoculation. You know, we're all in the time of COVID. And you know what COVID taught me? That for the most part, that people that never went on a vision quest and fasted, that means give up your family, give up food, give up water, and go sit in a sacred space and open yourself up to the cosmic intelligence. And even that little ant that's going to come walking on your leg, you say to that brother, how could you help me, pitiful me? And especially to us, the males, the men in this world, because what are we about? Well, we have a certain aspect of our being that says that if we don't like certain things, well, we'll go to war. We'll kill each other. You look at the missing and murdered Indigenous women. Why is that happening? Why is the earth, our mother, a woman, also being violated? It's because there's a knowledge and a thinking that men are misguided. So now, in order to realign yourself with that, you got to go and give all of this stuff up and open yourself to the cosmic intelligence. So when COVID came, and now people began to experience, there's nobody around. Nobody's coming to bring me food, water, different things that I need. I have to now reflect and be by myself and begin now to understand, who am I? Where do I come from? Why am I here? And where am I going when I leave this place? So to me, that was our mother teaching us about that inward journey. He talked a little bit about it too, from here to here. What is that relationship? You know, I'm fortunate. All of the things that I talk about today, I didn't know nothing of this. You know, my community of Ganawagya, I acknowledge all of my elders because we have our language intact. For the most part, you know, historically we were a Christian community. That was all our people knew. You know, in 2012, the Pope made Kadarida Kakwita the first saint, native saint on Turtle Island. But in our creation story, we talk about sky woman. And what I see is I see a Mohawk woman that has been elevated. Not for Christian purposes, but it's the idea that our time is here and we're resurrecting up in many ways. You know, we had a great peacemaker that came amongst our people when we were warring and killing with each other. If you look at what's happening on the other side of the Great Salt Water, that was here. And it was amongst our people, Mohawk, Oneida, Onondaga, Cayuga, and Seneca. And who suffered the most was the kids, the women, and the older people, because the young guys, in their mind, they got so perverted in their thinking that they saw every day when that elder brother son comes up, he's encouraging us to go to war and to kill one another. Then there was a reformation that came. There was this man, we call in our language, Ronu Shonidu, the one who's going to extend the house. And there's a lot of magic and mystery to this man and what he was able to accomplish. But what he did, he brought 5 nations together, Mohawk, Oneida, Onondaga, Cayuga, and Seneca. He gave us a constitution, a way of being, and a philosophy that says, we're going to uproot the great white pine, we're going to bury those weapons of war, and we're going to place a bald eagle on the top. Now, if you follow those white roots, you can sit under the shade and shelter of this great tree. Now it's a bald eagle. Why? Because it has a white head. In order to sit under that white tree, that great tree, you have to have the right mind. And in our language, we call it Gotniguriyo, which means the ultimate good mind thinking. Because if you have the ultimate good mind thinking, then you can follow those white roots and you can sit under the shade of that great tree. But where is that tree? Well, from a political perspective, that tree was planted in our central fire, the Onondaga Nation. But if we jump into my car right now and we go to the Onondaga Nation and say, hey, Ganasom, show me that great tree. You ain't going to see it. Why? Because it's a mindset, it's a philosophy, it's a way of being. You know where that great tree is? It's right here. If we want it, because you can go look in a mirror and all of a sudden be in conflict now with yourself, with your neighbor, your brother, your sister, with the earth, with the ancestor realm. But anyway, so that's part of that philosophy and that thinking. But here's what the peacemaker said. He said, if you chiefs, the one that sit in these positions of leadership, if you ever begin to argue and quarrel amongst yourself, you're going to revert back to the former, because then the men are going to vomit blood. And what that means is that what's going to come off their tongue is that, let's go to war. I don't like you. I'll punch you in the face. I'll make your nose bleed. And then it starts, the conflict. And then in my lifetime, in May of 1990 in our sister community. 2 young men lose their lives because Mohawks start killing Mohawks. And the peacemaker said, when this time ever comes, you go and you do this ceremony, you call for my return. I was part of that process. We went to Tyendinaga because that's where the peacemaker was born. And we asked for that intervention. And it did happen. And it wasn't this great big thing that some people are waiting for that's going to come and save us. It was a process that was initiated. Right after that, the following month, Elijah Harper calls the Meech Lake Accord. We go into a 78-day standoff with Canada. The next thing that happens is they start now what they refer to in Gatineau in the Department of Indian Affairs, Kumik, the Elders Lodge, that we have to start looking at the indigenous wisdom. Tommy Porter takes a group of Mohawks back into the Mohawk Valley to fulfill that. The white buffalo calf miracle is born in Wisconsin. All of these things. When our brothers got here, we made first the Friendship Treaty Belt, 1609. 1613, we made the Goswanta, the Turo Wampum Treaty Belt, which talks about this relationship, that said we would travel this river of life. We all know about the doctrine of discovery and the papal bulls and what happened. So now everything is out of whack. But now we're in the time, because we call for the peacemaker, what I refer to as the indigenous spiritual resurrection. We're going back, we're teaching our kids Mohawk immersion schools, language nests, picking up our songs, our languages, our creation stories, all that, and we're challenging the power. And even in the natural world, things are happening. Animals are coming to us speaking white. Why white? Well, anything associated with white usually says, well, that it's unblemished, it's clean, it's pure, it's holy. The animals are telling us, hey, two-leggeds, you better change your way, because look what how you're affecting us. The next thing that happens, why is it that these 215 kids' spirits resurrected up from the dead? Because what's happening is from this old country came this veil of fear. Fear God, fear hell, fear the devil, fear witchcraft, fear. And then with the monetary system, capitalism that says, you know what, let's extract, the earth is just a thing. It's not our mother, we're superior over it, so we can do all this stuff. So let's extrapolate, let's manufacture, let's produce, let's use, let's advertise, let's consume. And when we're done, what do? We say we throw it away. Well, where's away? There's no such thing as away. These things are all coming back to haunt us now. And now human beings are being affected because now we got air pollution, water pollution, land pollution, all these contaminants, all these kinds of stuff. And we're in a pickle now. You know, this young girl, Greta Thunberg, she says, you know what, you adults that run the world, your house is on fire, and you're acting like as if it's business as usual. The data says that I won't be around to be an old lady. But you know what? Our ways of knowing and believing and understanding that, even though data may say that, when we do our ceremonies and when we do all of these and we pray with that sincerity, things could change. And we could change the outcome. But like David Suzuki says, we're the last generation. It's in our hands now. Whether or not those future generations coming are going to inherit a happy, safe, clean, beautiful, peaceful, loving home. That's up to us. But anyway, we're in the time now of this indigenous spiritual resurrection. All these things are happening. And that veil is being lifted up right across this land, orange. Why orange? In our Mohawk language, when we say Gahuadzide, that's that sacred fire. But it's not just in the people that share my family blood. Every human being that's alive has that sacred fire burning within them. We're all extended family. So when you understand this teaching, we don't have a right to kill one another or to rape or even to commit suicide because we're all participating in this sacred dance called life. But anyway, this veil is being lifted up. And in our way of doing things in the longest, we have a condolence ceremony that talks about how we deal with grief and loss and hurt and pain. Because we're all going to be affected by it. And when it happens and when it hits you, you're going to cry. You're not going to really hear because your mind goes in a way. There's a lump, there's that tightness in your throat. And sometimes, depending on what it is, there's a knot in your stomach because maybe you're feeling guilty about woulda, shoulda, coulda. So that's why I say now we're in the time that as this veil is being lifted, that we all better begin to see different, hear different, speak different, and we better start doing different, because if not, we will all be gone in a very short period of time. But it's up to us. So now getting back to what I tried to articulate in the Wisdom Weavers, what I talked about was for us to be fearless. Don't fear God, don't fear the devil, anything that says be fearful. It's psychological warfare that you cause within yourself. But you just have to come from this ideology and concept and say, there's no such thing as that. In our creation story, we are love. We are precious. We come from that place. We're here for a short time and we're going back to it forever. No hell, no devil, no sin, none of this stuff. It's only here where we have a little bit of trial and tribulation because we're under auspices of two energies, the left and the right-handed twin. And they talked about it earlier, the other woman from the Blackfoot people and how she tried to articulate that. But it's the same thing. That as much as, we're, that good and that interplay that happens between us. So here we are. It's up to us. We have to come from this place of being fearless. Live each every day. Come from this place of fearlessness. Don't fear cancer. Don't fear death. Don't fear the devil. Fear nothing. Come from this place. You warrior up, not with arms, but with knowledge. Because that's the only way that we're going to be able to put these people and help them with unconditional love, regardless of what they've done. We're still here, and you have to listen to us because you're on our land and our house. And if you don't like the message that we're telling you, you can always go back home. But we have a responsibility to tell those future generations that are coming. We have a responsibility to future generations that they're looking up to us. Their face didn't come out of the ground yet, so that they can inherit a happy, safe, clean, beautiful, peaceful, loving home. And together, we can make it better. So that Turo, what it talks about, will be in balance, and we will live in peace, harmony, and joy the way the Great Spirit intended. So with that, thank you very much. Merci. Nawa.
At the age of 22, when she attended her first ceremony with the Ojibwe people, guided through a dream, she knew she had to help to bring back the ways of her people. She knew that through colonization and assimilation, her people had been robbed of what was rightfully theirs. She went on a mission to help her people and others reclaim their identity by going back to the ceremonial way of life. Now everywhere in her community and surrounding areas, the people are celebrating and honoring their rich heritage. Donna Augustine, much of your incredible work is about the reclamation of culture, the reclamation of our identity, the repatriation of our ancestors, etc., etc. Would you share a story of how you helped people in your community reclaim their identity?
Oh, ni got to go to see Mikchi Televisi. Ni mega mawi skutchbanuk lewi. Just shared with you, my spirit name is Thunderbird Turtle Woman, and I'm Migama from the East Coast. That Mikchish, that turtle, I carry that name of an ancestor that lived almost 3,000 years ago. He came to me in 1977 when I was pregnant with my second child, woke me up in the middle of the night and asked for my help. And as a result, I was guided. Our ancestors never had to do reburials because we never dug up the dead. And so even today, there's this silent injustice imposed upon our people, especially here in the north. There is no national law here in Canada, as there is in the United States, for the return of our ancestors that are being held hostage in those museums. Those ancestors are part of us. They run through our veins. ancestors have called to me when I walk into museums. Ancestors that are 4,500 years old, that are 6,000 years old, over 6,000 years old, older than the pyramids. They have come to me. So I know that each and every one of us, we carry our blood of our ancestors within us and that genetic memory. The reason why I lit the smudge when I talk about the ancestors, as soon as someone shared ancestor down there, I lit that smudge because they come. And I want to tell you that the Creator placed us here on Turtle Island. This is what I tell my people. He didn't place us in China. He didn't place us in Europe. He placed us here. And so everywhere we walk here on Turtle Island are the remains and the ashes of the ones who went before us. Every ceremony that we do as Indigenous people, we call upon the spirits of our ancestors to assist us. And there's a song that came to a man, a Mi'kmaq man, and it says, Budu Bwejia da Baktuk at Miktish Bemokwaladal. Bejigunwadwadal Mi'kmaq Dandoji Meduekiga. I will not sing that right now because it can't be recorded, but I want to tell you that the message says to him, he was carving a pipe and he said, he just cried. He said, like somebody poured water in his eyes through the whole message, through the whole song. And it says, the whale is coming from the ocean. The turtle is following close behind. They are coming to let the people know what hard times are here now. And they are here now. You turn on CNN and drones are hunting people, civilians, children. I said, oh my goodness, all over the world. And so the Creator gave us a way. We are still spiritually protected. We are on this land. This is what the late Albert Lightning Buffalo Child has shared with us. And our ancestors, they watch over us when we do our ceremonies. They guide us. We need to believe this, that they will guide us. When anything happens, I even tell non-natives, go to the first people of this land. They will know what to do. We are guided by dreams. We are guided by vision. In our language, you say, "Iganigaptiget," a person that has that spiritual knowledge. Every community has the people that know things before they happen. And so if anything major is going to happen on our lands, we will know. The dreamers will know. The spiritually gifted people will know. And it's not a power. It's a very humbling thing to carry that. And so when I was a little girl, before I could even speak English, I remember telling my dad, I must have been about 5 years old, and I told him, I know that there's people like us somewhere that pray in the old way. My spirit knew. So when I was 22 years old, and I feel really that this was prophecy, because our people were told through prophecy that there's a time coming that people from across the waters will land on our shores. Before that happened, some of our people had to go inland to take the sacred objects with them and that sacred knowledge, because they knew there was going to be an onslaught on our culture until it was time, until it was safe. And so I knew since I was a little girl. And when I attended my first ceremony at 22 years old, Manitoulin Island, with the Medewan people and Medewan, I cried to the ceremony. I said, here it is. Here it is what they took from our people. Nobody was doing ceremonies at home. Nobody. There were no powwows, nothing. I cried. And I couldn't wait to tell my dad because he's the one I told. And my dad was a residential school survivor. When I came back, I told my dad, where'd you do? I found it. My dad and I cried together as I shared that ceremony with him. And my dad used to drink to forget about all the abuses of being in residential school. From that moment, he never took another drop of alcohol. And there was a few of us, a handful, that started. It was quite difficult. We had to fast. Nobody was there to teach us. The only thing we knew was sweetgrass. We didn't even know about tobacco, sage, nothing of those things. I didn't even know to wear a skirt, the ceremony, nothing. I just knew I had to go fast and ask the Creator directly. And so this is how we were taught, by fasting, by learning directly from the Creator. And I'm so grateful today that, that now we share our ceremonies, our songs as we travel, that people have hung on to those, what we have lost. They've made a huge comeback. Now everywhere in our communities, there's sweat lodges, there's pipe ceremonies, there's Pictures of eagle feathers in schools. We're teaching our children, again, how to speak their language, but most importantly, to remember who they are. To never, I always tell them, never, ever let anybody tell you that you are not good enough and that you are not worthy, because you absolutely are. Every one of us. Yeah. And so this is my role. When I take those ancestors that I hear them, they call to me, and I put them back, and I don't get paid for this work. I've been doing that since 1977. I tell people I wish they would give me at least a gas card, but it doesn't matter. Yeah, yeah. I've had my electricity shut off I don't know how many times in the summer. That was fine. Yeah, and I do this work. But my payment comes when I take those ancestors, not just Mi'kmaq ancestors, ancestors of many tribes. I've even reburied non-natives that the museums didn't know what to do with. I told them, give them to us. We will bury them alongside ours with the same love and respect as our own, because nobody's remains should be on a shelf in a museum forever. You know? We all need the right to rest in peace. And I want to tell you that when hard time comes, this is what we need to share with our children. Continue with the ceremonies, put the tobacco down, honor our ancestors, because they're the ones that will guide us. When no government can, when no Google can, when no Pope can, when no political leader in this world can help us, it's the spirits of our ancestors that will always be there for us. This is the message that we need to bring. Because even where I come from in the East, there was nothing. They took it all away from us. And guess what? It came back, and the message was brought to this little girl, 5-year-old girl. And I was 22, I'll be 73 in June, and that's my life commitment. Thank you. Walalia.
Avery Denny is a Dene Hatali, or singer of the Blessing Way, the Protection Way, and the Night Chant. He has dedicated his life to retaining and teaching Dene Bizad, the Navajo language. He offers stories about the origins of leadership for Dene and the power of learning language. Mike Lerma, you are here representing Avery today. Please tell us how Avery's stories have influenced you and your family in your own learning, as well as your health and well-being.
Hello. Yat she Mike Lerma yenishe Buddha Pecha nishle she za Adrian Lerma will ye na kaida ne neligo nasht eje tapaha yas chin hodzo de shegan. I think one of the most powerful ways that Mr. Denny has improved my life is that I'm from the Buddha Pecha people. And I was brought into his circle, his family, through the notion of ke, or clan relations. And so I call him my che, or my grandfather. And I was probably like 35 or something like that. And I grew up just speaking English. I grew up in Oxnard, California. My people are from Michoacan, Mexico. I've never been to my homeland. I don't have my language, but he gave me his language, and he said, "Learn this language." And he goes, "I can't teach you Buddha Pecha, but here's some Denebazad. Use it." And I didn't think that was possible. I didn't know why he was trusting me with that. It reminds me of what Graham was saying yesterday, that when you have the markings, you have to take the responsibility that goes with it. I can't just go over and, "Hey, Avery, teach me how to sing. I want to impress this girl over here." You know? You're like, "No, that's not what it's for." I said, "All right." And so I knew that beforehand, and I was always pumping the brakes on my own. He's not my only teacher. I also learned from a gentleman named Robert Yazzie, a gentleman named Lorenzo Max, a gentleman named Rexley Jim. So, but I was always trying to be respectful. Like, it's like, well, I'm a guest within the Nebekea, within the sacred mountains here. I don't want to overstep. But they never worried about that. They just said, no, you're a relative, you're a 5-finger person, bila ashla. Sit down at the fireplace. We're going to eat. We're going to get warm. We're going to pray. They always treated me like I belonged. And I didn't understand exactly why that was happening. And then I met my wife. She wasn't my wife yet, and I realized that, oh, the Indigenous creator, holy people, they're building me up so that I can actually be a good man and be a good husband. And so today, we have 7 children all together, and my kids are Dene, and my kids are Budapecha. The son of Avery Denny, Emery Denny, is also a medicine man, and he tells me things about. He goes, and it's the same teachings that I hear. I keep hearing it here over and over again. That when we come into these ceremonies, our ancestors are here with us, and he tells me, he goes, I can see your ancestors here too, and they got all these feathers and stuff. They kind of look like headdresses, but they're actually from south of the border, macaw feathers and you know, the exotic birds, all that. And I feel it. The intuition says yes, but it's wonderful to have someone else confirm it and say, you're not alone, Mike. And those people from my lineage recognize what the corn pollen is for, what the arrowhead is for, what the songs are for, what the cornmeal is for. All of the instruments that the Neh people use, they recognize what it's for, and they're happy that I made it back. And I'm happy that I made it back. And I was saying this to my wife this morning, that when this is my second time to so-called Toronto, and the first time was because Michael invited Avery Denny, and Avery Denny wanted bodyguards, so me and my wife came to guard him. So we'll do that. And so we got him here. But on that visit and on this visit, I feel with you all as my relatives, as my mothers and my fathers and my uncles and my aunts and my cousins, my sisters and brothers. You're all my siblings. I feel that. I don't feel that very often. I feel it with my siblings, my mom. I feel it with the Neh people, and I feel it with you all. And that really makes my heart happy, because I've missed that for a long time. I'm going to be 50 years old this year, and so it's a long time coming. And so I love this, that we can come together and talk honestly and openly and figure out answers together. And so those are some of the ways that Avery has improved my life. He saved my life. My wife saved my life. My kids are always saving my life, because there's this other road over here that's really attractive. And I'm like, nope, my kids need me alive. I need to keep going. And you know, we're grandparents now, so I have to keep going. And it's Nejone. And I wouldn't have that. I didn't know that was possible, that I can have instruments. And so now I travel with my arrowhead, and I go over to that sacred fire and I say a protection prayer for me and my family and you all. And just kind of, any kind of bad stuff, get rid of it. I wasn't able to do that a few years ago. And like I said, I thought when I lost all of my relatives, because I lost my father when I was 6, my grandfather when I was 8, and my grandmother when I was 16, I thought, oh, that's it. We're done. We're done for. But little did I know that the end of Na'a would bring me to meet you all, you know? So, Ahiaha to everybody. I think I keep hearing Miigwech, so I'll say that too. I hope that's appropriate. But I say Ahiaha, thank you. I appreciate you all for treating us kindly, and let's be alliance partners, and let's survive. Let's keep surviving, and then we got to get to the thriving part too. So Ahiaha, Shidana. I appreciate you all.
Peter Wynn, at sunrise ceremony this morning, you shared a story about restoring a person's spirit to their body. Would you share that story with everyone here?
Yeah, it's, you know, they want you to come to the hospital. There's not much you can do at a hospital as a, you know, with our ceremonies and all their sort of conditions there. You got a fire extinguisher there, you know. You got the priest, the local pastor looking over your shoulders, being nosy and what the hell you're doing, making sure you're not out of line, which they don't have a clue about. So, but that's the stuff that we go through colonization. There's still that paternalistic attitude toward Indigenous people, but our stuff is far greater than what I believe that they'll ever be able to comprehend, except through the parables that they speak of in their stories. And that's what our elders call them. You know, those are just accounts of men at the time of Christ. And that's how he interpreted that stuff. He said ours is actual living from generations of things coming forward and the passing on of the knowledge and the ceremonies and the rights to the future generations. So this is an accumulation of strength, even though it was dampened a bit through colonization. Now we're beginning to come about and come back again because of those prophecies. And those prophecies are very true. The last elder that I learned a lot from was Albert Lightning. And basically he told me, well, the fire's been lit now. They'll never be able to do what they've done to us in the past. It's just going to grow and get stronger and stronger, even though it'll seem like it's a hopeless case at times. And those are my words, because that's what I feel sometimes. Where is this big fire? Where is this big, you know? And I don't see a lot of interest in a lot of our older generations, whether they're just plain worn out. That's all I can attribute that to. But it's the younger generations that we really have to really concentrate on. And I tell people, if you really want to learn this way of life, you got to start young. I said, because by the time you're older, I said, unless the Spirit comes to you and gifts you that and gives you that gift right there and then that's when you're gifted and brought forward from your bloodline, from your family responsibilities in your clan and so forth. That's when that will come about and the people will come. They will come to you. And that's what I talk about when the spirits come to me. They said, the snake would come, big serpent, scare the heck out of me. I'm just a child. And he's looking at me, and the tail, you can't even see where it ends. That was the first one. And 4 nights in a row it'd come. Just huge. And I'd be just shaking there as a child. Not very old at all. And I could feel him when he's coming because of the power that he's bringing. And then so forth, the other ones coming forward, the other spirits coming to talk, tell me things. And I used to be so afraid of that because, you know, we're human beings. We're not accustomed to that. And a lot of it was hidden because of our elders were not ashamed of it, they were hiding in it. And that's what we call, they were hiding in the church. They went underground. You know, they'd be sitting there in the mass listening and all that, but their true beliefs were with their own traditions. They had to mask themselves and become invisible to keep this stuff alive. And, you know, I have lots to share in regards to a lot of those things. But in the ceremonies, how I have come to understand them, it's the spirit world that brings you the answers. You know, you want to talk about indigenous knowledge, indigenous psychology and psychiatry and so forth. We can do that. You know, I've learned that much to be able to translate that and interpret that in an indigenous context, and to relate that and how we see that and how we view things. You know, our elders tell us right here, your pituitary gland, that's where everything functions. Even your thinking, your thoughts. When an elder looks at you and he's got that gift to read you, he knows exactly what you're thinking or what your problems are. You don't even have to tell him. That's how gifted our people are, for those that have really gone to the deep end of the medicine wheel, deep into that world, that mystical world. And that's what the elders told me. You're so deep now, you'll never come out of that. There's no way you'll ever come out of that. I don't even know how you did it or why you surpassed me. I said, I just listened to your teachings and I just kept going in the bush. And the elder said, if you want the gifts, the best thing I could tell you is go in the bush and fast. Bring those gifts back for the people so you can help our people, indigenous people. That's the best advice I could give you. That's why I say we've got to train our young when we can. We didn't have those opportunities in the earlier stages, but the ancestors and the grandfathers and the Grier didn't forget about us. He instilled it in us and he brought it forward from the time of disruption till the time when we start to get interested and say, who am I? You know, what am I all about? I'm sure there's more to us than just being drunks. And the way they look at our women as, you know, they don't value our women. And that's what started me on my path to find out, okay, who are we? I started to quit drinking, started doing all kinds of, left all that craziness behind. And even though I'd already had those visions, I knew there was something different about us. There's more to us than that. And we're beginning to stand up for ourselves, you know, and I used to get heck when I was young because I'd stand up to white people. I wouldn't let them push me around anymore, you know, and my mom would get scared. Don't say nothing. Why not? Who makes them the boss? You know? And I'm just a child, a kid, you know, starting to stand up for who we are. I'm tired of them. I went through the residential school. They tell you when to go to bed, when to eat, when to shower, you know, what to do, all that kind of stuff. And that's why I don't really like the system at all. I don't care for it at all. We have to live in it, we have to work in it. But you got to do this, you got to do that, there's so many freaking regulations out there, it's not even worth following, you know. To follow the true spirit of who we are and what we are about as Indigenous people. You want to talk about reclaiming our identity? Well, that's what it is, stand up for ourselves. Not to be militant, but to do it in a good way, and we show through example. And our elders talk about those 7 grandfather teachings. That's the love that's there. That's what we use. That scares the hell out of them when they can't really provoke you. They wonder why they're not getting a reaction. And that they can't figure that out. But that's our strength and who we are and what we're given. Even the spirits tell me, even though the treaties were signed, we still see this as only indigenous land. We don't recognize the others. They don't come from here. This is ours. You guys have the rights to do what you want with this land. It was given to you. That's how it works. And that's how I go by it. And those pictographs, that's our history. That's our language. Just because it's not in the context of the global view about written language, that is our language. You know, you can interpret it. But because it's not up to their standards, we don't have a language. They gave us syllabics. you know. The ancestors don't even look at that and recognize that. It doesn't belong to us. Anyways, getting back to what I was originally asked, is that the gifts come to you and you get strength. There's 4 levels. They call them degrees of governance. And it's the elders that elevate you, and they do ceremonies privately. Some will never see that. And I was inducted into that through the elders. Every now and then I'd be working, I get a pipe, work for years, learn to understand that pipe, learn to read it, learn to interpret it, and they would guide me through that, teaching me along the way as I would get the visions. And then my first pipe I had for years, but they wear out after a while is what people don't realize. Because they get hot, they bake, soft rock, they become fragile. And the elders say some of them you'll be lucky they last 25 years. So that's why today when they find a pipe that's 500 years old or whatever, they're so excited about that because they know they can reach back to that time and know the history of our people and what we went through. They can read that. So the rock has always been here since the beginning of time. That's the ones, and there's processes for that. There's only one spirit of the rock, they tell us. But it's the spirits from the heavens that come into those stones and make it alive and bring it alive. Could be a buffalo, a bear, whatever. And that's what you carry with you, and that's the gift you bring with that when you bring that grandfather there. And you move on, and you go, and then the elders will bring you back in again and say, okay, I was fasting up in the mountains and come down, and not much happened. I thought, well, it wasn't too much this time. And the elders were walking out. I said, what did you see up there? Did you experience anything? I guess he kind of knew. And he always smoked a pipe. And yeah, I seen an eagle with a medicine wheel. And that eagle's there behind it, and the medicine wheel is there. Turns around and says, congratulations. I said, for what? They've just given you the recognition of being a teacher for our way of life. That's what that means. So we don't get a piece of paper. It's that stamp of approval from that. The eagle always brings good things. He never brings bad news. You got to learn to interpret those animals and what they are. They're bringing you a message. I could go on and on about what those things are in the different animals, but I don't have time here for that. But I'm going to go back to how I got to where I am. I went out and I fasted on my last one. I always heard Albert go, okay, I'm going to go try it. I said, I'm going to go in a bush. I had the elders put me out. And they said, how many days are you going to go for? Well, I'm going to go for 7 days and 7 nights. And I'm going to the 5th day. Next thing you know, the late Albert Lightning shows up like a ghost coming through. Come by the fire where I am. And all he says is, Peter, because that's what he always used to sit down. You can go private somewhere and just talk, me and him. You have done what I have done so long ago. I knew what that meant. You got what you came for, now get out of here. But I still had to honor those 7 days. But I'll tell you, you're starting to die after, because your reaction is, when you're thinking to open up your hands, it'll take you a couple of seconds before that reaction occurs. And so you know you're starting to leave to go. You put yourself on a line between life and death for that. That's how far I went. That's how close I come to death to get that. And I brought it back. But it doesn't come right away. You still have to mature. I was young then. I had lots to learn yet. Then as I get older, the gift starts to come more. it starts to evolve and starts to work more, because you have to mature in your mind, That's what has to happen for a lot of men. And I see a lot of young men trying to do all this stuff. They still got family yet. They still have troubles. They still have a lot to, to tend to, just like we've all had to. We've all had families. But we don't understand that then. We don't get that until we look back and we can read our life after. You know why you were put there. You know why that happened. You can read all that and you can explain that, because you've learned to understand your own future and your own destiny. And that's how I look at those things when I see that, those gifts were coming. And the last one I will share with you, and this one before I get to other things, is that the Spirit showed me it's like real life. People are gathered back home where I am, and everybody's scared, And they're all gathered around, and that thing's in the bush there, black, tall, it's the beast. They talk about that beast. And they said, all of a sudden the Spirit, which one's going to go? And right away I put up my hand, crazy, I'll go. So I left. But before I left, they loaded me up with cedar, the medicine of the cedar. And I went inside there, and the battle was on. And I come out of there, and people were saying, they're all excited coming back. They're surprised I come out of there. And they said, what happened? I beat him. And the people, they were happy, and I woke up. And I know what that meant is that's the stuff I would be contending with throughout our life. Because the elder Albert Lightning would always tell me, the evil one is not too far off. He's just waiting for you to slip up. And that's when he comes in at your weakest time, your weakest moment. And he's got you then. So there's more I could share about that kind of stuff. But that's the real realm of being a traditional healer. I can only speak of myself. I can't speak of others or any other person that's doing this work. I can only share my experiences. I'm not saying theirs is wrong or less than. I don't do that. All I can do is share the experiences of how it came to be for me. I used to run away from them because I didn't want to do that. Finally, they cornered me, floating around in the air. You can run, but we'll always find you. And you can never hide. So I was there and I said, okay, what is it that you'll have me do? And they just dissipated into thin air. And I could hear them talking. Next month, my life changed real quick, real fast. Everything just fell into order. And all those things I experienced as a child, them spirits started to come forward, starting to help. The real work is beginning now. Set it all up. That's the story that I'm talking about, of how I came to where I am today, to be able to do that. And it's the grandmothers too, very important in my life. They're the ones, they called me out of the blue and said, Peter, we got nobody in our family to carry the shaitan. In our way, it's only the men that run those. And we don't have a living bloodline anymore. They're all gone. Will you consider taking that? I'll think about it, I said. I'll call you tomorrow early. I used to get up early anyways. And I said, okay, what will you have me do? You come over here tomorrow morning, early. And they set certain conditions there. They got everything ready. And there was another grandmother on top of that one who was even older. She was actually the one directing it. But she was so scared of her own community because her community was all born-again Christians. So she was phoning her granddaughter, who was already old, telling what to do and how to direct it and how to pass that ceremony on to me. So I understood that. So we went up to the mountain and they got me to build it and how to do all this and whatnot. And now go in. And in there, I thought I was going crazy. There was so much happening in there. So much spirits coming in. It's coming from the mountain. And the ones that had gone on, her family bloodline, they're sitting there smiling, looking down at me. And that elderly lady knew. She's gone now. But it's those grandmothers, when they talk about the drum and the ceremonies, it's really powerful when they bring that to you, especially from my grandmothers. Very powerful. It took me over a year just to settle down. It was so strong, I didn't think I could handle it. That's how hard it was on me. And today I carry that and I use that for people. I don't have to build it no more. I just stand there and sit there. It'll work for me. I'll just do the pipe ceremony. Or I'll just sit there. That's where I am today. And I'm beginning to understand the universe a bit. Just like my elder told me. Now I'm at the stage where I'm beginning to understand the universe. And I was just young then, I'm thinking, what the hell is he talking about? Because it's beyond me, eh? I'm too young yet, not mature enough yet. So when we share a lot, we know a lot of people aren't grasping what the elders are saying. But it gives you the ability of chance for people. It's a hit and miss for people's lives. There is no guarantee in life on anything, none at all. Anyways, I tell that to people. The mom's in an incubator, oxygen tank, I guess you call it or whatever, in the hospital. They say she may not make it. And I found out about it, and I know the family well. I said, well, I just found out. I said, I didn't know she was in there all that time because I had texted her and wondered why she never responded, and she normally does. So the family says, can you come to the hospital? I said, you know, I can't. The elders tell me that even if that person's in front of you dying and they don't ask for help, you can't cross that line. That's the way it is for us. That's the amount of teachings and discipline you have to have. So I told him, here's the protocols. Bring me the tobacco, bring me the prints, bring me the berries. That's all I'm asking for. But you have to bring it to me. And I'll wait here. It'll take a couple hours or so, 3 hours later. I said, I don't know what's going to happen until I begin the ceremony. Then they're going to come and tell me. And I started to light the pipe and do the ceremony, put everything out and get it all ready. And it was powerful. The pipe's just jumping and my arms going hard. The shake dance coming. The spirit of it. And my partner, her heart starting to palpitate. Going like that and scared the hell out of her. And I said, you know, we're done. I knew she was going to be all right, but I can't tell the family yet that. I'm waiting for more. More will come. But I gave them what I could, because there's some stuff you got to hold back on. You don't give them everything. You wait. That night I went to bed, and I'm laying there, and it's like I'm in her body. And I'm looking around my eyes, I could see the family sitting in a waiting room in a circle like that, calling out. And my family is gifted. And I'm calling out to my boy, my oldest son. Then he comes. because I couldn't bring her out of it on my own with all that I have done. And my son touches my shoulder here in the hospital. And I was able to come out of it. What that means is that if I was not able to bring her out of that and just lay there, she wouldn't have made it. But I knew within the next day she was up, she was eating, she was, starting to move around, and they shipped her to another to get her energy back because she'd been dehydrated, all that medical stuff that has to occur. And, she's alive and well today. And, when Joe Hester passed, I'm laying there sleeping, and my woman's very gifted too. She said, I seen a man come out of you, an old man that was kind of receding hair, long hair. She says, I said, do you know anybody like that? She said, because I've taught her a lot. I said, yeah, it sounds like a few of them that I know. So, that don't sound like him. No, that don't sound. And then she's seen Joe's Hester's picture. That's the man I saw. She says, yeah. I said, it means he was going to leave this world. That's what the message was. Within that week, that same time, my sister had passed away. So I had to go to 2 funerals, and I really worked hard that time. And I got no help from anybody. I just did it on my own. I even buried my own sister through the ceremonies of our people, Cree traditions. Told them what they needed, how it had to be done, and so forth. And that's where I am today. And that's the calling I have. That's all I can share with you. That's all I know. Other than that, I tell people, I don't want to know anything else about you until you bring that tobacco. A lot of people don't understand what that tobacco is when they bring it to you. It gives you that permission to delve in that issue of whatever sickness or is going on with that family. That's it, and that's all, and you can't go beyond that, or you're breaking the spiritual laws. You're going beyond what you've been allowed to delve in. So, so much more to say, but I shared that this morning because I want people to know that we have our ways to. Shake tent one time, somebody comes standing there, and I was younger then, so I could go in and out pretty easy. And the spirits say, it's their blood, and I got scared. No, grandson, they said, just sit there, you're not going to feel nothing. So I trust them. I said, okay. All of a sudden, I seen the blood coming. And the sand, it's going through the sand of Mother Earth. You know what sand does, eh? Captures things and purifies, and it goes back into that person's body spiritually and physically. It's hard to explain that. I was thinking, geez, that's better than dialysis. But that's how I relate that. You want to talk like being a doctor? Well, here's our way, You want to talk psychology? Well, here's our way. We have it all. We don't have to do, a lot of what we call a comparative analysis. We know the truth. It's already in us. We just have a hard time because our minds have been polluted. And everyone has a circle. I'll share that with you. And your circle is it's here. Should be white, blue, beautiful colors. And there's a multitude of colors. And it should be pure. But what happens is when you're starting to do drugs and you're starting to do booze especially and whatnot, you become susceptible for that other stuff to get into you, and like gray matter swimming around in there. And that's causing you the confusion. And you don't know if you're coming or going after. Now when you work on somebody and it starts to clear up, you're going to hear like bullets flying. And people will say, "What is that? What did you do?" "Oh, no, there's nothing. You'll be okay." Your plate is dirty. That's what the elders that I learned from that taught me, that you had to clean up your plate, but it's your spirit. Everyone has that circle. And that's what they mean by don't do those things. Don't go beyond things. Because you're putting yourself in a position of being vulnerable. And I'll tell you, when you want to talk psychology, I'll give you a simple one. Your first thought, if you're of your right sound and you're solid and you follow the teachings, that's the one you follow, the elders say. That second one that makes you second guess things, that's the one that's the confusion. And when you follow that one, that's where things go wrong, because you didn't listen to that spirit telling you. And that you can internalize that and to a form of it by being identified as psychology. You can talk about people being out of their mind and so forth, but we don't have time for that. There's too much to teach. But I'll leave it at that, and I'm just grateful that I was able to share some of that for you, because many people think, it's a medicine man, he's beating up a rattle there, and you see him on TV and he's making nonsense noise, We get those sounds from the spirit world. That's where we get that when they come in the sweat lodge. They're singing that chant. And they're singing, telling you where to go. Go to the mountain. Take them to the mountain. That's what they were telling me. And I took that man there. As soon as he got to that mountain, he just keeled right over. And I left him there because I know the spirits were working on him. About an hour or so later, he comes crawling out of there and composes himself. "Okay, you ready to go now?" Yeah, okay. Didn't have to say anything more, But that's when you really believe strong, really believe in what it is that you're really doing.
Peter, thank you for talking. Thanks. I just wanted to say, at the beginning of the Wisdom Weavers series, we would ask the people that were presenting, what do you think you'll say, or what do you want to talk about? And quite often, the response would be, "I don't know what I'm going to say," because it will be the Spirit that will be talking through me. And from that, I learned to not interrupt. I interrupted you, Peter, today. I'm sorry for that, because I know it's the Spirit that's talking through you. And I really feel it's important that we give everybody the time they need to say what they want to say to us. So thanks to all of you. My heart feels full after listening to all of you today. And I just want to say thank you. Yeah.
And thank you, Michael.
We've gone way over time, so we don't have time for questions. I'm very sorry about that. Yeah.
Thank you. Yes. Wow, I just want to say thank you so much to all of the elders and knowledge keepers, the wisdom weavers that shared so much with us in that session. We really appreciated it and appreciate all of your words and your teachings. I want to share that all of the individual interviews that were done with all of the wisdom weavers can be found on the Anishinaabe Health Toronto website. I really appreciate that I've been able to share with you all over the last 3 days a little bit of my story and my journey of knowing myself, and how that was connected so much to my dad's experience. And how I learned that through the podcast that I did about my dad called Stolen Surviving St. Michael's. I didn't get all of the answers that I had to the questions about my dad, but what I came away with was a deeper understanding of what he went through and how that shaped his life. So I'm just struggling with the slide here. Oh, there it is, yeah. I feel like through interviews with my other siblings and my aunts and uncles, I got to know the part of him that I missed out on because of residential schools. After my dad left residential school, he struggled for a lot of years, but he kept going. And he eventually reconnected with his culture. He reclaimed his language and connection to the spirituality that they tried to take from him. And he became an incredible father and grandfather and cultural leader in our community. In our podcast, near the end, after some particularly difficult interviews and after I uncovered some, really devastating information about how the abuse that started at St. Michael's Indian Residential School kept going, came home with my relatives, and how they ended up shaping my own life and they were connected to my own abuse. I followed in my dad's footsteps, and I went to the sweat lodge that he used to go to in our community. And I just want to share one more clip from our podcast where I talk about the impact of that ceremony on me at that really difficult time in my life. So we're just going to hear a short clip. I'm not going to talk about what happened in the sweat. Junior said I shouldn't. But when I came out, some of what I'd been carrying was lifted. After the sweat, we ate. My Auntie Carol made soup and bannock, and as we sat together talking and laughing, I felt lighter and lighter. This is where my dad came when he felt heavy, when he didn't know what to do with the pain and trauma he held inside of him. And I understand now why it was a relief for him. Once you can begin to let go of the hurt and reconnect with your culture and your family and your community, you can start to heal. And hopefully, eventually, you can become the person you were meant to be.
Go ahead, Mr. Cameron, your opening comments.
Bonjour, Tanse. My name is Howard Cameron, Sr. of the Beardees Nokimasis First Nation, Saskatchewan. I am the ceremonial keeper for my community. I am a father, grandfather, great-grandfather.
For years, my dad engaged in community work, and by 2011, he was part of a panel advocating for Indigenous kids. Here he is speaking at a Canadian parliamentary hearing on child welfare.
First Nations children need to remain in their communities, where their ties to their culture, language, and value systems have the most impact and provide the greatest chance of success to disrupt the cycle of despair created by intergenerational effects of the residential school.
He'd seen the results of residential schools. He lived it, and he saw how it affected his kids, nieces, nephews, and grandkids. And the children, my dad says, deserve better.
In the Cree language, Awasis is a child. Awasiwan is children. And in literal translation of Awasiwan is the shining ones. when we talk about children, you know, they're sacred. Their future is in our hands. They don't have the power to make the decisions that we are able to do to guide them to that good place. So let us learn from our mistakes and let us do better. Merci beaucoup. Thank you.
Thank you very much, Mr. Cameron, and I'd also just like to recognize...
It's emotional
Let
hearing
us
his
learn
voice.
from our
Oh,
mistakes.
sorry, we can emotional hearing his voice again, but I felt like it was so appropriate to share that with you all because of what we've all been learning, and how it's connected to what he learned and what all of our ancestors know and learn about the importance of our culture and our family and our communities and our kids. Because I think all of this work that we've been doing over the last few days is for us and it's for our own knowings, but it's really also for our kids and for our families and our communities. And I'm grateful to my dad for getting to that place after what he experienced, and all of the survivors of residential schools, of day schools, and of 60 Scoop. Your strength and resilience and ability to persevere and take back what was stolen is something that is so inspiring and admirable, and I thank you all for that. I want to invite Gahandagwas Diane back up for a closing thought and to again say thank you all for sharing this time with us.
Sego Scano Sewagwego Gahandagwa Syungyats. I want to begin by saying to the Creator, Nyawa, for giving us this beautiful life. For what we have witnessed here over the last 3 days has been, for me personally, a fulfillment of my prayers and the dreams that I've had. The elders who are here on stage are the cultural treasures of our people. They are the spiritual guardians of this knowledge, and they need to be well loved, well supported, and they need to have that opportunity to mentor and pass on that amazing wisdom that they hold. And so today, when I think of this work, Creator, I also think of that generation that we heard from here, the generation in their 30s and 40s and mid-50s. And when I think about that generation, I think about my times in the Sundance Lodge, in the Ghost Dance. I think of my time in the Contrary Lodge. And I think about all of those times when I went into those lodges to drive 3 days from my home to dance with the Anishinaabe Nation in Manitoba, to participate in fasting lodges 4 days long, to bring my children with me and a babysitter so that they'd always be cared for, and to then drive home and go to work the next day. I made that commitment, and I kept that commitment for 20 years. And I did that because I took young people and the prayers for young people into that lodge with me. I never went into those lodges, any of those lodges, whether that Sundance was in Manitoba or South Dakota or in Nevada in the mountains. I went into every ceremony bringing the young people in that lodge with me, that they would have a beautiful life, that they would understand who they are, the gifts that they carry, and that they would have an abundant and joyful life. So today, what I want to share with all of you and with the elders that are here is that you are truly the fulfillment of my prayers, the fulfillment of my dreams. And I'm so grateful to all of you. So I want to say to you, Sangwe Disong, thank you. Nyawa Ganalunkwa, I love you very much. Nyawa Sangwe Disum for all the beautiful people who are here, their brilliance, their beauty, their contributions to the well-being of that next 7 generations of children. I believe now, Creator, that our future is secure. I believe that what I've witnessed here over these last 3 days has given me a strength that I only prayed about, and now I have it. And so I thank you, Creator, for helping me to witness what is truly alive among the people in our country. So I say to you, Sangwe Diso, I'm so grateful for each person, for their families, their clans, their nations, and I'm so grateful that they have made an incredible contribution to our future. So today I ask you, Sangwe Diso, to help them to get home safely. Many have come from way far across the ocean and the continent of Turtle Island to be with us here today. And so I ask you to hold them, care for them, and ensure that they have the fullness of life so that the next generations will flourish. So with these words, on behalf of all of us, I raise all of you up to that altar of the Creator underneath the sun, and I say, Nyawa Sangwe Diso, Miigwech, Nyawa.
I think we all owe our next speaker a great thank you for helping to bring us all together over the last 3 days. I'd like to invite Michael Millward, who's the interim director, executive director of Anishinaabe Health Toronto, to deliver a closing statement.
I'll keep this very short. One of the things that I kept thinking was during the conference that is similar to what Diane just shared with us is that whenever people speak of Indigenous people, I find it really frustrating when they only speak from a place of deficit. And I know from this conference, from the last few days, we are really a strong people. And all of us, with all our gifts, we can do so much together. And I've always said to people, the best people to help Indigenous people are Indigenous people themselves. So I wanted to say thank you to everybody. I had a long list of thank yous, but we'll send that out by email. I want to say thank you, Diane. Thank you to all the traditional people that came to be with us at this conference. And I wanted to say thank you to the clients. Everything we do is for you. And I wanted to say thank you to the AHT staff. I'm so glad we were able to have you attend this conference. I'm sure you all feel the same way as I did or do. I feel full, and I know all of you are going away feeling the same way, and I hope you can share what you've learned here with the clients that you serve as well. And that's everything I have to say. Thank you. Thank you.
And one more time, I would like to invite our visitors. Graham Tipene and his family are going to come back on stage and treat us with one last performance. So let's give them a warm welcome.
ka tira tēnā tātou. Paku mihi tēnei. Mātou kua whakaeke mai ki roto kia koutou ki runga ki tō koutou whenua. Mātou o Ngāti Whātua, ngā uri o te kāinga, ngā mokopuna o ngā mātua tupuna, no roto o te aroa. Tēnei mātou e mihi ana kia koutou. Koutou i pōhiritia mai kia mātou, kia whakaeke mai nei ki tēnei o ngā kaupapa whakahirahira a tātou. A tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko a mātou tupuna e mihi nei kia koutou tupuna. Ko rātou katoa, ko whetū rangitia, ko mātou tēnei. Ngā kanuhiora e mihi nei tēnā koutou katoa. Before we perform, we have a gift. On our first day in Toronto, we were given a tour of the Anishinaabe. Huri here? Huri here? Huri here? We were given a tour of the Anishinaabe Health Centre in Toronto here. My people want to say thank you. We want to say thank you for having us. In the 4 days we have been here, we have done more than the 4 weeks we were in Barcelona. Our hearts are absolutely full. Our hearts are full, our minds are full, and we are ready to do the work again when we head home. That is because of you. That is because of the sharing. That is because of the sharing, that is because of the words that we have shared over these last few days. Michael, I want to thank you. This is for your house. This is for your health centre. This is for your people to look upon every day. And remind yourselves who we are, so that maybe one day when you come down, you can meet us all again in our reservation with our families, and that we hope will be soon, so that these connections are never lost. So this piece here, the bodysuits you saw our people wearing, this is a representation of the bodysuits. That is what you see. The science behind it is puhoro. Puhoro literally means frictionless motion. The puhoro design that is in our skin talks to when we carve our canoes, in the bottom of that canoe, we put this design on. As the canoe hits the water, because it's carved in, that water then bubbles, creates an air passage underneath. Technically, our canoes go timber, air, water. You have the god of the forest, the god of winds, the god of water. All three are looking after all the paddlers that are on top. So for the hospitality you have shown us this week, for the love you have given us, and the flash hotel rooms, I can guarantee we've never stayed in a Hilton ever. We thank you. We thank you from the bottom of our hearts. This has been an amazing trip, and the young people here have experienced things they may never experience ever again. My nieces here are yes people. Do you want to? Yes. This is happening. Are you coming? Yes. And I'm very happy that they got to see a whole lot of things that we don't have back home. So, Michael, we want to present this to you.
Mai a te tupua, mai a te tawhito, mai a te kāwi o ngāri ki oi. Ka tākina tamauri, ka tamauri takea mai i o rongo. Rongo i te ngāngana, rongo i tā niwa, rongo i tōro, rongo i tōro mea. Tēnei tāra whakahono i te rangi ki te whenua ki te rangi tā o kiko ki tā wairua. Wai nuku wai rangi wai ai o i te pai ta mahara i pū wai te Māori. Ko te Māori nui, ko te Māori roa, ko te Māori take, ko te Māori matua kore, ko te Māori matangaro. Ko te Māori i te timatang, ko te Māori i te wakamutinga, ko te Māori i hono ai tātou ki tāo tawhito ki tāo tū neke. Tēnei te ara ki a tāne nuku, tāne nui āngai, tāne te wānanga kai ki te taumata ki tiki o arangi. Hare a ngā kino o te pō, ngā tapo o te pō, ngā mana o te pō, ke ai o i rongo, ke ai o i roro. Ka tautaranga o te akaeke, eke panuku, eke tangaroa. Tūturu whakamaua ki a tīna. Tīna! Hui e tākie!
I think Graham and his family should think about opening a hotel because there will be many of us traveling to see you. I've said this before about people, Maori people. It's good to know that there's other people in the world who are fighting the good fight. So I wanted to tell you thank you for coming. Thank you.
Kia ora e te whānau. Hello everyone. We're about to perform a waiata that is known as a waiataringa. It's an action song. So you'll see a lot of movements of the hands, a little bit of stomping of the feet, a little bit of movement of the body. We'd like to introduce you to Tira Mai Ngā Iwi. Now we're going to bring back a crowd favourite. We're going to introduce you to the poi, which is this lovely piece of technology that we have here. So please enjoy this. Kiko. another crowd favorite, we're going to bring back the haka. And so if you would like to join us for the first part, we're going to do the haka that we taught, and then we're going to move into something that, a lot of other people may know from our rugby team, the All Blacks. Nō reira. O tēnei paua, ko te puru, paua tōmata, ka uwe, katu, tangata, ui tariri, e tore tariri, e tōmei, koi para, ka puta waiti a kato, tariri, kamate, mate kora, kamate, kamate kora, tēnei te tangata, ura nānai teki, mai whakawhiti tērā, koi pane, whiti tērā, hei! Now for our final item. I'm out of breath, if you didn't know. But we've got a little bit of an item just to finish off our show for you. It has been an absolute pleasure, as Graham had mentioned. Lovely to be here, lovely to be amongst such wonderful people. Tēnā koutou katoa. And breathe.
Kana
lucky are we? That was incredible. Thank you so much to Graham and his family for traveling all this way and for sharing so much of their talent and their beauty and their culture with us. To close out the performance today, please welcome Red Bear Singers. They are a drum group comprised of residential school survivors, 60 Scoop survivors, day school survivors, and intergenerational survivors who all sing together to support themselves and our communities in healing. Welcome, Red Bear Singers.
sorry. So these are the Red Bear Singers, and we're not all here right now. Some of us are at a conference, some are all over. Yeah, we're not all there in the head either. No. And it's really beautiful to sing with these ladies, like, you know, with everything that they've gone through and showing the resiliency and, you know, showing the next generations that it is possible to uphold these teachings and take back what was once taken from us. And I love these ladies very much. We have Bernice over here. We have Susan. We have Clara. We have Rose. And we have Anna. And these ladies are warrior women in our community, and they had fear of picking up that drum and learning those songs, and it's been really beautiful to watch them grow and flourish and sing proudly, and it's beautiful. And I just want to say chi miigwech to that, and they want to share their favorite song with you, which is the canoe song. So miigwech.